April 20th, 2021. And could we please have the roll call?
Supervisor Levere.
Here.
Supervisor Long.
Here, and just to let you know, I'm hearing a lot of echo.
Thank you. Supervisor Huber.
Here.
Supervisor Ramirez.
I'm here.
Chair Parks.
Here, thank you. And could you please join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now we're at the time for our minutes. Do we have a motion to approve the minutes of April 13th?
Huber, so moved. I'll second.
Thank you, Supervisor Huber, Supervisor Levere, and thank you for getting these minutes to us so quickly and so clear. Thank you.
You're welcome. Supervisor Levere.
Yes.
I'm sorry. Let's do another motion, shall we?
Okay, we have a motion from Supervisor Huber and a second from Supervisor Levere.
Thank you. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And now let's go to our agenda review and call on our CEO, Mr. Michael Powers. And Mr. Powers, you are muted if you can join us.
Hi, Supervisor Parks.
Yes, hello, Mr. Pettit.
Hi, this is Mike Pettit. Mike will be with us here shortly. I can run through agenda review if you would like.
If you'd like, or we could go to our moment of inspiration and then come back. It's up to you.
That would be good. If we could.
Okay, let's do that. We have a great opportunity on our agenda every meeting to have a moment of inspiration. And this morning's moment of inspiration, it goes to our appreciation to teachers, and really want to thank the teachers, particularly during this really challenging time with COVID. And this morning we have Janelle Hogue, who's a kindergarten teacher from Walnut Elementary School. And Walnut Elementary School is in the unincorporated area in Thousand Oaks in a community called Casa Conejo. And we have introducing her, Eileen Wall, who's the principal of Walnut Elementary. And we just really want to thank the teachers, the staff, the patient parents, and the students, who weren't able to do the classroom learning, but now they have really done such an excellent job there in providing some seamless transition into being able to be back in the classroom. And thank you very much, the endless energy, seemingly endless energy of these teachers who really have provided invaluable education to our youth. So with that, let me turn it over to our principal over there. Good morning, Ms. Wall. I see that you are on.
Good morning. Thank you for having us here. I'm very pleased to introduce Mrs. Janelle Hogue, who's one of our stellar teachers at Walnut Elementary and CVUSD. And she's the perfect person to share with you this morning. First of all, because she is such an inspiration to me and to our students and to our colleagues. But also, she's perfect because she has really experienced the different learning models that we've offered this year and done just a beautiful job with it. At CVUSD, we had students return to campus starting November 9th, those whose parents chose to have them return, which has been about 2/3 of our students. 1/3 decided to stay remote. So we've had students continuously on campus since November 9th, half in the morning in an AM cohort and half in the PM. And it has really gone so well. And Mrs. Hogue has taught both models. So not only remote for the first trimester, but then every day she teaches half of the day with students on campus in her classroom and the other half remotely. So I'm pleased to turn it over to her so she can show you some pictures and share some inspiration.
All right. Good morning. I don't know if I can't see. I sent some pictures, a slideshow, so I don't know if that's showing right now. I can't see it. Oh, there we go. Okay, so like Mrs. Wall mentioned, I am currently doing half of my first cohort with 12 students that come to school, and I have 12 students that are still on remote. So we started the year, you can see this was my classroom setup, and I will mention that I moved classrooms at the beginning of the year. I was teaching 5th grade, and I decided to teach kindergarten. And so I was in the middle of moving my classroom, and I just wanted it set up so that I could still be as normal as possible for these kids to come in and just do school like it was normal. So this is me with my classroom setup. I'm Zooming, but I'm also using all the technology that I could possibly use during a pandemic. And also here is my class doing their first project, coloring a rainbow. You'll notice rainbows are my favorite. So that kind of inspires me. So that's that first slide. You can turn to the next one. I try to make my day as fun and normal as possible. And I think it inspires the kids to come to school and enjoy school. And so you can, again, rainbows. I'm very goofy. This was Crazy Hat Day on one of them, and all the kids dressed up with their crazy hats, and I wore that all day long, my rainbow hat. And this was, the next picture is Halloween. And we had a drive-up Halloween parade that the PTA had put together, which was great. The kids got to drive up in their Halloween costumes. We normally have a Halloween parade at school, but we had to do it a little different this year, and this was what we came up with, and the kids loved it. It was a great success. So we started out the year all remote, and then in November, the beginning of November, we knew we were coming back to school, and again, it was going to be really different. The kids couldn't sit on the carpet. They had to be 6 feet apart. And so my colleague and I created buses out of our desks. Kids are in kindergarten are not used to sitting in a desk by themselves for that long. Again, these kids didn't really know the difference, but it was fun just to make it look like they were coming into a classroom of cars. So they each have their individual walnut, rather than a VW, they have their walnut mobile ready for them. So, and you can see the kids were super excited to come in and join in the classroom. So the next slide is just an example of, we had, this is a field trip that we went on, which was on campus. We had our maintenance guys come out and show us what they did during the day, because we couldn't go on a typical field trip. This was my remote group in the afternoon. This is the little cart that they walk around in, and we went on a field trip. We pretended like we were on a bus. We put on our seatbelts. We were on a bumpy road. I actually dropped my computer, so they got to experience a little accident. But here they are, and they're watching the maintenance men talk about what they do during the day to take care of our school and keep it beautiful. And then here is my remote group as well, doing an art project in the class. I'll mention during all this, the kids come to school once a week. My remote group comes to school once a week and picks up hands-on packets. So I'm constantly putting together packets every week for them, because I feel like they still need to experience everything that they would even if they were inside the classroom. So this is them just recently doing a little spring craft with the Easter Bunny, and they like to show their picture, take a picture and smile. Here is science and recess. So we still get to incorporate everything that we would normally do in a normal day. And these kids are on the left, we're learning about motion and force. And so we made ramps to see how fast a ball could go down a ramp. That was fun. And then the girls over here are experiencing their recess. It's different from when we were here normally. And so they were practicing their yoga moves. I don't know where they learned that, but it was super cute. And they're spread apart and they just know they could do hard things. It's never been an issue. They came into school, I think, because they didn't really know the difference. But they've adapted so well, and it's been amazing to watch. And now they actually get to play on the yard, so it's pretty exciting. And the last one was just some cute videos I took of my students in the morning and in the afternoon. So if you want to play, there's 2 videos. These are to the left, my students, what they like about school. I don't know if those videos will work. Well, so I'll just tell you what they mentioned. So they talk about, on the left, my kids in school, just what they like about school. They like learning. They like numbers. Jackson, what do you like about coming to school? Learning? Teddy, what do you like about coming to school? Math. Awesome. What about you, Layla? What do you like about coming to school?
I like going on my computer.
You like going on the computer. Okay. Arya, what about you? What do you like about coming to school?
Break time.
Break time. What about you, Jace? What do you like about coming to school?
I like to play with my friends.
You like to play with your friends. Awesome. So that was just some of their ideas of what they liked about school. The remote group, same thing. It's really inspiring to me as well to see some of these kids who have never met their friends person to person. And we have a little recess break every day, and they stay on and they play with each other over Zoom. So it's great to see the connection that they have. And I think next year when they do come back to school, they're still going to have that same connection. So thank you so much for inviting me to come. It's been a crazy year, but I will say it's very, very inspiring to come to school. And I love my job very much. And I'm just so glad to be a part of Walnut and the CVUSD. So thank you.
We are all so happy to have you there, and it is inspiring. And the kids are so resilient, and what thrills they have just to be with each other in person, as all of us do, but particularly them, because the children so much need to have those friends, and that it's great to see. And you are definitely an inspiration. So we thank you for the hard work, extra hard work you and your fellow co-workers all have to do, the wonderful teachers at Walnut Elementary School, all the teachers in our county, everywhere. We just are so appreciative of the harder work you had to do. And it's so wonderful to start seeing the kids all back in the classroom, and the teachers too. So thank you so much, and congratulations on your success in getting this. Appreciate it.
Thank you so much.
So that was inspiring. Go ahead. Okay, thank you. It is very inspiring to see that, isn't it? And makes you very hopeful. So now we'll go back to our agenda item, I believe it's 5, and go to our CEO, Mike Powers, to provide us any changes that we might have on our agenda.
Thank you so much, Chair Parks. I apologize for that. Yes, item 8 on the coronavirus report, received 2 letters, one from Lorena Sadawatari and Judy Bruce. Item 9, opening public comments, comment letter from Lorena Sadawatari has been submitted. Item 16, CEO's office, approval of appointments to Women United of the United Way of Ventura County. A revised board letter has been submitted. Item 36, CEO's office, receive and file Annual report on the status of the Museum of Ventura County. Comment letter from Bill Miley has been submitted. 37, CEO's Office. Public hearing regarding adoption of the 2021-24 Memorandum of Agreement with the Union of American Physicians and Dentists. Comment letter from the Civil Service Commission has been submitted. 38, Healthcare Agency. Adoption of a resolution to add 70 physician and pediatrician positions for the Ambulatory Care Clinic Integration Project. PowerPoint's been submitted. Finally, item 40, CEO's Office, fiscal year 2021-22 department budget presentations. A PowerPoint from the Ag Commissioner's Office has been submitted. And that's it. Thank you.
Thank you very much. Board members, do we have a motion to accept the agenda as revised?
Huber, so moved.
Long will
Thank-
second.
Thank you. We have a motion and second, and could we please have the roll call?
Supervisor Levier,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you. And now we will go to item 7, and this would be the consent agenda items.
Calendar, Madam Chair.
Okay, thank you. I believe that's a motion from Supervisor Levier. And is there a second?
Long will second.
Thank you. We have a motion and a second on the consent items, and that would be items 12 through 30. Could we please have the roll call?
Supervisor Levier,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you very much. And then let's move right along to our coronavirus update, and I'll turn it back to Mr. Powers.
Thank you, Chair Parks, board members, community members. Yeah, let's get right to it. And maybe if we could go to slide, there you go, there's what we're going to cover today. And maybe we can go to slide 3 and just do a quick overview of what we're going to, just a couple of highlights. And just thank you again to the community for the work you're doing. Ventura County is heading in a really strong direction. See over 582,000 vaccines administered, first and second dose. That's over 53% of eligible population in our county has received at least one dose. And this third one, I know this is really important to your board. Over 85% of seniors 65 and over have been vaccinated. That, I mean, it just speaks for itself, really protecting those vulnerable populations. And we appreciate your board support and helping us get there. The health metrics you'll hear from Rigo Vargas. 2 of the metrics are in yellow, which is amazing. And I really want to highlight the equity metric, which is down to 1.5%. You hear a weekly report on the great work of the team and the community partnerships that we have, really working to get those hard to reach communities. And you can see in the data now that it's really paying off. We are at a point now where we're starting to consider possible vaccine hesitancy concerns. So the team is developing communication plan for that. So you'll be hearing more of that going forward. And want to just highlight too the testing. I know we focus on vaccines, which is right, but until we're up to 70, 85% on that, testing is a really important part of our effort to battle the pandemic here locally. And we continue to be, and the community continues to get tested at a very high rate, over 4,000 a day, which is remarkable, even as we're transitioning to the pods, to the testing pods. So very smooth transition there. Appreciate the team's work with that. And then, of course, our business assistance grant and rental assistance, we're going to hear more of that. And your board's going to hear, per your request, about the American Rescue Plan and what that means for us here locally. With that, I will turn it over to our vaccine task force lead, Barry Zimmerman. Thank you.
Thank you, Mike. Next slide, please. I'll just go over some of the numbers, details. As Mike's referenced, we've done a tremendous volume of vaccines to date. This week will probably be over 600,000 vaccines total administered as we work through our appointments of first and second dose strategies. So we're at first dose, and it was mentioned at 53% of the total adult population. 53.5% of the total adult population has received at least one vaccine. which is an excellent rate, even though we have advocated and fought hard for vaccines. We have been keeping up with a good pace. Overall, the state is around 52%, so we're slightly trending above that pace right now. So activities continue well. We have seen a slight slowdown in the rate in which appointments are being filled. So for example, to let you know, we release all the new appointments, the bulk of them Monday morning around 7:30. In the past, they would be completely filled by within the hour. It took about 4 hours to fill them up this week here, there. So this is not an unusual trend. This is happening across the state. And so that's where we're looking at. Is this more the population that needs more education? There's some hesitancy or so forth. And so we're working forward to address those and to come up with strategies to outreach at a greater pace. Next slide, please. This slide here is just an illustration. I just wanted to show you the volume increase. This is a kind of a daily total of the vaccines that have been administered. We have seen some peaks, but in general, since late February or early March, we've been relatively flat in our vaccines. And this is what we've been consistently reporting, that we have not seen a significant growth that we would anticipate, even though we've had little variables of increases here and there. It has been relatively flat. The light blue bars are just to illustrate that we are catching up to the second dose appointments, where they are significant in number, and we should see going forward even second dose and first dose appointments. We have had some bubbles with the second dose appointments, but feel as of last week and this week, everyone should be caught up associated with it. If someone feels that they are reaching their deadline or past their deadline and are unable to receive an appointment, we are allowing some to go to a clinic, and we will work with them to get them in so they can get their second appointment there. It is moving forward. We do not anticipate huge growth in our vaccines that are allocated to the local health department. It appears that growth in the county as a whole will be administered through the third-party administrator, and many of those vaccines will be distributed through other networks, such as pharmacies and other medical clinics that have been established that prior have not received the vaccine will start receiving the vaccine as well. And so that more will come. That's the initial planning that we have at this time. Next slide, please. Just a reminder that everyone 16 and older are able to receive the vaccine. As a reminder to the public that 16 and 17-year-olds are only authorized to receive the Pfizer vaccine. So as someone comes and makes an appointment, they need to be assured that it is a Pfizer clinic where they can receive it. This past weekend, I visited the clinics, and quite a number of our younger youth have made appointments and are receiving the vaccines. Make a highlight here that we have set up with excellent work throughout the county and the teamwork of OES to set up a site at the College Park in South Oxnard that has been set up and is starting this week with appointments as we ramp up the vaccines there. It is a large volume site that can do up to 3,000 doses a day. And we are just hoping that we will get more dedicated vaccines in order to fully utilize that site. It is a contracted site with OptumServe, is a state contracted resource for our benefit, and a similar site will be up and operational in Simi Valley on the week of May 8th. As you know, just a reminder, the Johnson & Johnson vaccine is currently paused by the FDA, and no allocations are received to us at this time. Next slide, please. Just as a reminder, this is where we can go to get vaccines appointments. Is myturn.ca.gov is the primary system for registration. However, you can get to that through multiple ways. You can do that through the state site. You can do it just by Googling it, or you can go to VenturaCountyRecovers.org and we will link to that, as well as provide other information associated with making appointments. There is a helpline for those that don't have online access and can call that, and it is available for them to help them get appointments. There are other sites that we are not necessarily the hub for, and some of the federal pharmacy sites, national chains such as Rite Aid and so forth. You can go to those sites directly and they have information on how to schedule at their pharmacies throughout the county. Next slide, please. Once again, vaccination records are important. This slide here is to provide information regarding the where you can go to get a record if you've lost your little card that shows that you've been vaccinated. You can make a phone call as referenced here, or go to CARES, that's the California Immunization Registry website, to request documentation that you have received your vaccine. Next slide. Just a few clarifying policies here. Teenagers can get the vaccine without their guardian or parent present, but they do have to have a note authorizing that they are eligible, or that the parent grants permission for them to get the vaccine. Okay, it would be most easy, and I encourage that parents accompanying the youth is the easiest way to certify that they have consent and are able and eligible to receive that. College students who attend college in the county, they are considered residents of the county. They just have to show that they're attending the college here locally, and they would be eligible for the vaccine as well. Next slide, please. And I think that concludes. I'll conclude with this. We are still doing, as Mike indicated, testing is a priority. We still have testing sites throughout the county. We have converted many of our big volume sites to smaller kiosk and self-serve sites. They are manned, so individuals can receive services as they go to the kiosk. And we are still maintaining a above average volume throughout the county through this strategy as we transition to actually greater access points, but throughout all the community, using a vendor that's hosting those testing locations. And that concludes my short update.
Thank you, Mr. Zimmerman. Supervisor Long, you have a question?
Yes, and that I'm just really impressed by the numbers our community has stepped up to get vaccinated. 85% of the 65 and older is just a huge number. The question I had was on your 63% of eligible population. Is that 16 and over, or was that our last marker?
That's we do it based on 16 and up is the adult population we're using for our universe. Also, to indicate that we are still reaching out to the senior population. We do want the highest penetration we can in that older segment, and so we are making efforts to reach out to them as well. We do have home-based services through our mobile clinics that individuals that are homebound seniors can call and schedule an appointment. And the nursing teams that will go out will be able to offer vaccines to the individual as well as to the families in those homes as well.
And that's a great service. Do we know what our target is? Is it 85% of our population? I was just wondering as to the staffing and all of that we need to prepare for, or you have already prepared for. I was just wondering what we think our target number would be.
I think we want to get as high as we can. I don't think we have we discussed it with the seniors. We want it as high as we can. We're about 85%. It'd be great to get above 90 associated with them since they are the highest risk population. We still see some illnesses in the hospital, and it's mainly the aged population. So that's our highest risk group that we continue to focus in on. There is questions from the CDC on what level is herd immunity. Is it 70%, 75, 80%? So the science is still out on that. We feel that most protection would occur if we encourage everyone as possible to receive the vaccine.
Well, thank you very much. I was at the vaccine site yesterday getting my shot, and the people that work there are just so helpful and just great.
You're muted. Okay.
I just wanted to say thank you. The people that are working at our sites are just really helpful, and it was clean. Music was great to move your arm. Just a really good upbeat vibe versus you're getting a shot, you're dreading to go to the doctors. It was really great, and I just wanted to say thank you to everyone who's doing it. Thank you.
Thank you, Supervisor Long. Supervisor Ramirez, you have some questions or comments?
Yes, just very quickly, and I want to congratulate Supervisor Long on getting her shot and apparently not having any reaction because she's looking her usual bright self today. So my question for Mr. Zimmerman is, what is the status of the vaccine tourism? And I know we're right next to LA, which has been, through a lot. I have friends and relatives there who've really struggled to get the vaccine. There's been a little bit, shall I say, of confusion over there. Can you say anything about that? Thank you.
Yes, thank you. Two activities have occurred around outside county residents coming in and making appointments. The state has set up within the My Turn system a geofencing activity, which means that someone with a residence outside a geographical area would not be eligible to make an appointment. Doesn't mean people will change their addresses and so forth on that. In addition to it, we have listed on the sites that our locations are for Ventura County residents only. And so when they come with a confirmation of a piece of paper, it says right at the top, Ventura County only residents. So if they show ID or information that is outside, we're able to turn them away. We do that. Since we put in those several measures, the number of individuals coming in has decreased significantly, and so we are not being impacted like we were when it first started.
I want to just do a follow-up here with folks who are immigrants. There's been some concern. First of all, people do not get charged for the vaccine or the testing in our county. I don't know what the situation is elsewhere, but I know people do get charged for testing in other counties. Maybe that's because they're going to a private resource. But here in our county, we do not charge for testing. We do not charge for the vaccine. The vaccine, I hope it's free everywhere. My goodness. But also, there's been some concern about folks who are immigrants who may not have even a California driver's license. They are also able to get the vaccine, but what kind of identification do they need to show?
They only need to show information of their name, and that's it. So we have instructed our staff on how to work with individuals, in particular those that may have limitations with documentation. For the activity to receive and register them is basically this is a document that I am who I am, and that's about it that we require for them to do so. And I haven't heard that occasionally there's some confusion, but we try to work with everyone to get them the vaccine. Our goal is to get them in and not to screen them out. And so that's our objective. In addition to your comment, we do not charge for vaccines, nor do we charge for testing. Even with our vendors that we put into place for the testing may collect insurance, but if they do not have insurance, everyone will receive it. The insurers should not be charging anyone for a cost, a copay, or anything associated with both testing or vaccination.
And just a final follow-up, folks are coming in to do the harvest, and they are migrants. They're maybe without the documentation others have, but they would still be able to get the vaccine, correct?
Yes, if they're working within the county, we do get them there. We do have our committee that works with the ag industry and are very familiar with the type of mobility that occurs with seasonal work. And so we are working with them to make sure that with the farms and others that we can still get access for vaccines for them.
Thank you so much. That's terrific.
It is great to see the penetration of the vaccines into the community, and then particularly the high numbers for seniors 65 and older. And I wonder how we compare with other areas. And I know that we had a slightly different strategy than other counties in that we kept it to 75 and older for longer before we opened it up to the next tier. And I'm thinking that may have been part of the reason why we're having such excellent penetration, particularly with that group. But it's great to see, and certainly shooting for 90% is a good goal. Supervisor Olivier, you have a question or comment?
Yeah, thank you. Just two quick questions for Mr. Zimmerman. First, with the vaccines, I know as we've gone through April, our supply constraints have remained, and obviously the Johnson & Johnson pause hasn't helped us. But are we fairly confident that's going to change as we head into May?
We're hopeful, let's put it that way. The state growth in vaccines as were projected, a lot of that was based on an infusion of Johnson & Johnson coming in. So that has leveled off the state's, I would say, assumptions with a significant growth. We do anticipate growth with Pfizer and Moderna. There, we just have not seen long-term projections of where that growth is. We do anticipate some growth coming forward in the month of May. But let me caution, there's kind of two forces going on at this point in time. We may see more allocated to the county as a whole. The third-party administrator then administrates or divides that up of what networks will get that vaccine. What we anticipate is probably a moderate to a level of the same level of vaccines coming to the health department, which is the public health system, and greater vaccines being administered through other networks, such as other pharmacies, other medical systems, and so forth. So the anticipation is vaccines in total will grow for the county, but within our network, we may see the same level. If that's the case, we will look at how to best utilize our resources. As you know, our capacity can deliver a lot more than what we get. If we don't receive it, and that's not going to be the ongoing strategy, then we will have to adjust schedules and so forth to put our capacity in better alignment with the vaccines we receive.
Great. And then speaking of Johnson & Johnson, do we have any update as to where the CDC is on that pause?
They are still, as far as last report I had, they're still reviewing and gathering more data around it.
So no timetable known at this time?
No.
Okay, great. Thank you.
And back to you, Mr. Powers.
Yeah, mute, Mike.
Yeah, that might help. Thank you. Just two things to highlight, Barry mentioned, is the mobile teams are so important, and have 15 mobile teams out there in the community doing pop-up events in our ag community, and vaccinating homebound seniors is so important. And then what Barry said, I thought was really, what a great idea. Not just the homebound senior, but anybody else in the household. Sort of while we're there, let's just vaccinate everybody. I think that's a great approach. And so a lot of good things happening there. And then the transition to more of the state sites is real important too. As you know, our county has over a couple hundred employees staffing these large mass vaccination sites. So, that's not sustainable in the real long term. So they've been doing an amazing job of being able to build up the state sites and draw down our employees back to their departments is really important. And the team has a good plan for making that a really smooth transition. So with that, let's go to our Public Health Director's report from Rigo Vargas. Thank you.
All right, good morning. Thank you, Mr. Powers. Good morning, Chair Parks and members of the board. Just 2 slides today. Keep it short and to the point that while we're not going to be reaching the yellow tier today, unfortunately, but the good news, though, is that we're really close, and we should be getting there perhaps even next week, but certainly I think by the following week, we'll reach the first week's tier. So let me go one by one on the top row. The 2.6 is what is expected to be our case rate as posted by and made official at noon by the state. That is a modest improvement from 2.8. So last week it was 2.8. 2.6 is really good, and it's so good that at one point we were at the beginning of the month in January, at the beginning of the year, our high was 82. To go from 82 to almost 2 is just outstanding, and just a testament to all Ventura County residents and businesses, everyone, community leaders, yourselves for your support, everyone working together to bring down our adjusted case rate from 82 at the beginning of the year to now 2.6 is just, again, great work. Sure, we're short in meeting, the first week metrics for being eligible for the yellow, but look at that, we're at 2.6. We need to be less than 2, so we're right around the corner. Making these type of improvements, once you improve so much, takes a little bit longer. We also think that the Easter holiday, while Ventura County residents also thank you, we did really well during the Easter weekend, and also so far there's no indication that spring break had an impact in our county, so thank you, Ventura County. But our numbers stayed when it came to cases a little bit flattened, if you will, during that period. So I think moving forward, if we all continue to do what we need to do, hand hygiene, the mask wearing, and avoiding large gatherings, especially indoors, I think we're going to be making further improvements. But again, that's just really good improvement in our case rate. So the other really good news is that on the second and third, their number of the percent positivity rate, the overall positivity rate of 1.2 is just really, really good. That's a further improvement, although very modest from last week, but we were already meeting the yellow metric for this number. It needs to be less than 2, and last week we're at 1.3. A little improvement to 1.2 is still a testament that overall, while there's still community transmission and person-to-person transmission in our county, the positivity rate, the rate of positive tests is decreasing. And we're especially proud of Ventura County residents, especially from our hardest hit communities corresponding to the Oxnard communities, especially 93033 zip code, 93030, and then also Santa Clara Valley communities, as everyone knows, has also been really hard hit with cases and hospitalizations. And so to see this number, 1.5, is really outstanding and outstanding achievement, I believe. We need to meet the yellow metrics. It needs to be less than 2.3, and last week we were at 2.6, so we were just over. And today, happy to report that at noon it should be made official that this testing positivity rate corresponding to our health equity need areas at 1.5, I think is just also something to be proud of as Ventura County residents. And we thank, especially again, not only the residents, but there's a lot of community-based organizations that we partnered in these hard-hit communities, community leaders, many elected from the city councils in those communities of Santa Paula, Fillmore, and Oxnard. We meet on a regular basis, almost every Friday. And so just that partnership, yes, it was very tough, especially during the surge, to see these numbers in these communities, but to now see a 1.5 testing positivity rate in the hardest hit zip codes is really good to see. And again, there were some concerns early on that that some of these numbers in these communities would keep us or prevent us from moving into the to the better tiers. And no, it's the overall case rate that is preventing us to move further. But again, we're making improvements, and we're almost there. So I think I will pause on this slide if there's any questions. I only have one more.
Thank you. Do we have any questions? Supervisor Long, did you have some?
No, thank you.
Okay, great.
Madam Chair, I have one question. I'm sorry. Mr. Vargas, I'm curious if there's any update as to the potential loosening of the standards to get into yellow, given the statewide vaccination totals.
Yeah, thank you, Supervisor LaVere, for that question. Actually, there's been some discussions on that, and I think the state is holding, steady for the actual changes that already took last time into effect when we reached 4 million vaccinations in the hardest hit communities statewide. They did adjust that time the yellow tier metrics, and so there's no further indication that they're going to move that. Again, even we're right around the corner. We're already meeting it for 2 out of the 3, and our case rate needs to be 1.9, and we're at 2.6. So we're real close. And so yes, we can't wait, until we get to the yellow, the final tier here. But yeah, I don't expect the state to make any additional adjustments.
Great, thank you, Mr. Vargas.
Actually, I do have a question, Madam Chair.
Sure, I thought you might.
Oh, you know me so well. It's just on the basis of Supervisor LaVere's comments in regards to opening up, the importance of getting our businesses and our schools going. Really wanted to say thank you to everyone, public health, for helping the safety plans to make sure our schools are safe. My only question was just on the lines of June 15th. What are the parameters we need to make sure that the businesses know about, so that they can gear and get ready. That's really what I'm just trying to make sure we do. And just wanted to ask, is there anything else we need to know for June 15th?
Yeah, thank you, Supervisor Long, for that question. The state has assured us that they will come out with additional information on the June 15th date, that target goal date for when these tiers go away, the blueprint for a safer reopening goes away. What they already told us what won't go away is mask wearing. It still can be highly encouraged, and if not, still required. And so we support that. We don't, especially with the variants or any new viruses that might come around. We don't want a summer resurgence of a surge. So that's so far what they've told us is that it'll stay steady, the current guidance around mask wearing. Other than that, yeah, pretty much everything else will open up.
Thank you.
This is just so encouraging. When we were in the purple, when we were in the red, it seemed like forever. But now that we're, moving on so quickly, it seems it is just so encouraging. And really have to say a lot of it has to do with people, adhering to the protocols, the COVID protocols, and then outreach with the vaccines. And I'm just really happy to see that. Right now, I think that concludes our board comments and questions on this, so I'll send it back to Mr. Powers.
Thank you, Chair Parks. Board members, if we can go to the next slide just real quick, you can see that's the summary table. The best number there, of course, is no new deaths and then the low hospitalization rates. So, with that, I'm sorry, we got that.
Yeah, Mr. Powers, just because the numbers just came in for today, preliminary numbers. If I can just cover that real quick. So, these were excellent numbers, by the way. They were for yesterday over the 3-day period. And so to see 79 and then 12,000 tested, it was really great. So today we are expecting, where did I go with that number? about 34, I believe, is a new number, and then about 2,000 tested. So still really good. And then unfortunately, we're going to be reporting one more death. But all those three curves, that's why I didn't have the slide, continue to trend in the right direction. They've been flattened. Our current hospitalizations, been around in the high, teens, and so still good progress on our daily numbers. Thank you.
Thank you, Rigo. And yes, so if we could go now to Rosa Gonzalez, our community liaison for our health equity update.
Good morning, Board of Supervisors, Chair Park, CEO Powers, Rosa Gonzalez, Community Liaison with the County Executive Office. Today I'll be sharing some of our health equity effort updates, but also some of our vaccine information and some of the areas of work that we're working with some of our vulnerable populations. As you can see within the numbers, we have to date administered over 23,000 vaccines. When we look at the vaccine numbers, what we're going to start doing now is reporting actually first, second doses all combined in the J&J vaccines, because we're seeing a lot of our farm workers that have came into the county now moving to another county. And this kind of goes to your question, Supervisor Ramirez. What we're seeing is also, and we're going to now have farm workers from other counties coming to our county that might have not been vaccinated or will need that second vaccine. So we're doing quite a few efforts on that part to really make this easy and support our farm workers with getting vaccinated. What we're doing is continuing our work with ag industry and advocates to help us identify those workers as they're coming or leaving within the from each business. And as we continue having our vaccine clinics, is making sure that they're aware of that information. So if there's one close by, we could coordinate to have those workers also participate and come in and get a vaccination, either be the first or the second. Another thing that I'd like to share is just how great it's been to have our farm worker resource program at every single one of these clinics. And because not only have they provided resource information, but I'll share in a situation that we just had, which is because our staff is speaking Mixteco, they found that there was a large number of Mixteco speaking workers at this one location who shared with the staff, with our farm worker staff, how majority of them are leading to the Salinas and Monterey County. And so what we're going to do, our public health team is going to reach out to those entities and try to coordinate and let them know that we have a large number of farm workers that are now going into your county, that we did give the first vaccine. We've shared the information about, the importance of keeping your vaccine card and just any proof of their vaccination and just how critical it is, but also to find out if there's any information that we could share as these farm workers are going to other counties, just to keep that line of communication amongst counties open, the same, so that we are also prepared for any farm workers that come into our county too, on how to best service them and help them, just as we feel that the line of communication amongst county staff and those administering the vaccine is really where we'll be able to adjust anything that we might need to really help our farm workers coming into the county, especially the same with outreach efforts. So it just shows the teamwork and the amount of work and just how much we're constantly adjusting based on the need constantly within not only the past months, but also in the coming months. So we feel that that's a really a great way to really have our county prepared as we start seeing other workers coming in, because we are going to be doing vaccines for quite some time. So when we look at our mobile vaccine team, they've done almost 11,000 vaccines, and most of these have been at a lot of the local farms. Yet today we're at Driscoll's. They're going to do about 300 vaccines, and this Saturday they're going to have a vaccine clinic over at Mission Produce where we estimate about 500 vaccines. We also have some other smaller ones and happening throughout the week, but we just wanted to highlight those. Our county clinics are also, they continue to administer vaccines also. They're at about 7,500. And our pods also have we still unfortunately have been unable to extract any more updated information from our last time, which was in March 27th, but we estimate we'll have definitely a larger number of farm workers that have visited our high capacity vaccine sites too. And as Mr. Zimmerman shared, just how easy we are making it easy for our farm workers that do come, and just to try to make it easy for them to get vaccinated, as long as they're able to just give us their name, number, and again, anyone on site is also going to share with them pretty much the same information, the importance about continuing to practice social distancing at the workplace and at home, but also to save their vaccine card so that way moving forward, if they don't, let's say if they receive one of the ones that require the 2 vaccine shots, so that they'll be able to have that information moving forward. And again, these numbers do not reflect other partners such as pharmacies, clinicas, those are being administered at Ralph's or Dignity. So we're seeing a great amount of vaccines being provided to our farm workers in the farm working community. Our mobile team also has done well over 6,600 vaccines within our community clinic vaccines. And just yesterday, they had the SEIU IHSS vaccine clinic over in Durley Park, which estimated about 500 vaccines. So that's another great targeted way to help get vaccines out. We also last week had a vaccine clinic at the Port of Hueneme Administration Office that had an amazing turnout too. There was a lot of community members that really helped share that information too, and we shared it on social media. And so we had a great turnout at that event also. Upcoming, some of the community clinics that we have will be tomorrow in Fillmore at the Veterans Memorial Building, and then Friday at the Santa Paula Community Center. If of these are also allowing walk-up registration, so that'll make it easy for anyone within the community that possibly isn't able to sign up online. If they're welcome to just come up, and walk-up registration will be available at these 2 community clinics also. Our homebound seniors, I know it was shared earlier, they have vaccinated well over 1,000 of our homebound seniors, and it's going to be great to also, as we start doing our outreach, as Mr. Zimmerman and CEO Powers shared, we're going to be including also family members too when we do some of these visits and make those available. We're also going to start working within our mobile team, similar to what we did with our pop-up testing, but we're going to connect with a variety of community organizations and groups to try to hold these vaccine clinics, because even though we're seeing some vaccine hesitancy, we feel that we'll also get some people that'll be like, well, if the vaccine is conveniently in a location that it's easy to access, and they know their friends and family are also going to go get vaccinated, that they will also participate. So another one we just connected with is also with Delante Comunidad Conejo, Thousand Oaks, who through over 200 families in that area. So as these vaccines partnerships with our community partners continue, we'll be reporting and sharing that information with this board also. We're really excited about this partnership. And other efforts that the county, last week, your board approved the Housing for the Harvest program participation with the UFW Foundation. That's a great and exciting partnership too. That's also adding a whole nother layer of support for our farm workers. And again, it's going to be really beneficial too for those farm workers that are also coming in from out of county too. And outreach, there is a lot of outreach and information still going out, not only from our county PIO team, but also our farm worker resource program. And again, connecting with all the various community partners that we've been working with the last few months countywide has really been beneficial to continue getting this information out, keeping the public and our communities up to date with what is happening with COVID. And also emphasizing the importance of testing and also any resources that are still available, because even though we're still starting to open up, we still are finding that there are families that are still in need of support. And, one of the things coming to soon will be the second part of the farm worker housing assistance program that we're continuing to work to. And in addition, with the outreach, again, the county is working with the Ventura County Community Foundation, their complete vaccine outreach team to try to get really enhance more of our efforts with getting the information out to a lot of these communities about vaccines, which we feel is still very important that we need to continue. So with that, I'm happy to answer any questions.
Wow, that is just so impressive, the outreach. And particularly now when the vaccine is available to everybody, that we can take these pop-ups into these communities where they may not have computers or, as easy access as the rest of the population. And our diversity numbers are showing, as a result of that. So just really a great penetration there. Supervisor Levere, and then Supervisor Long, you have some questions?
I'm sorry, I don't have any questions, but thank you, Rosa.
Okay. Thank you. I saw your hand up.
I just wanted to, thank you, Madam Chair. I just wanted to say thank you. The connection between the other counties is really important, especially when we've heard the migration of our farm workers, where their jobs are, and getting them their first dose, but then what happens? Making sure that they're supported no matter where they go is really a strong point. I think question I had was in Central Valley, like besides Salinas, is there anywhere else do we need to be working with? Maybe that's a statewide conversation, and just appreciate it. So I'll ask my guys too. Thank you.
Great, thank you.
And also Supervisor Ramirez.
I just want to express my thanks to Rosa and the team and everybody working on that. I'd like to say muchísimas gracias. Thank you.
De nada, gracias.
Thank you.
Thank you.
And then, back to you, Mr. Powers.
Well, yeah, thank you, board members and Rosa. There is so much packed into this slide, and it's a summary. Look at how much is there, and then the community partnerships. Some are touched on, our clinic system pharmaco research program, but Clínicas, RALS, Dignity, SCIU, Adelante Comunidad, UFW, VCCF, that complete count committee has over 200 partnerships. Then you've got MyCop, Plan. There are so many community groups and promotoras groups, and multiple different ways of offering it, not just one, mobile teams, pop-up clinics, community health clinics. So appreciate your comments, board members, and just the team's focus in this area. And yes, it is showing results.
And working with the farmers too. I mean,
the farmers,
the farms,
right? Oh my gosh. Ryder, Limonera, Mission. The list is long of great growers and farmers out there. Absolutely. And our Ag Commissioner's office too. Partners very closely. Okay, with that, we will turn it over to our health officer. Oh, sorry.
Can I ask one more thing? I just wanted to say thank you to the community. We heard from SEIU just recently that they wanted to make sure that their team was getting vaccinated, and our group stepped up to do it. Our farmers asked to get the vaccines for their farm workers, and we've stepped up to do it. I just want to say thank you for the collaboration between county and our businesses and our unions and so forth. I think that's our strong point for the county, and I just really appreciate the sensitivity and making sure that we listen to our community and really just try to address as best we can their needs and assistance. So thank you for that.
And if I can just elaborate on that too with the SEIU, these are the in-home support service folks that go into the homes to take care of vulnerable people. So it is a priority that they are vaccinated too, so they're not bringing this into the home, just like we did with our healthcare workers.
Exactly. Thank you. All right. With that, we will turn it over to our public health officer, Dr. Robert Levin. Next slide, please.
Good morning, Chair Parks, members of the board, Mr. Powers. Just to follow up on something that was raised earlier, I have not heard anything about the status of the Janssen vaccine. A week ago, when this came out, we were told that there would be another meeting to reconsider what additional information had accumulated and to look closely at those 6 cases that have occurred at the end of this week. So we will be finding out, hopefully, more information later on. I also want to anticipate the last few comments I make a few minutes from now, and that is I'm going to be talking about how to get the COVID vaccine. So please, if you're interested in getting the COVID vaccine, if you've been postponing getting the COVID vaccine, if you've been questioning how to get the COVID vaccine, please go get a pencil and paper right now and be ready because I'm going to give you that easily digestible way of doing it in a few moments. Here I wanted to update people on something that's been a common concern, and that's about the variants in California. I'd like to be able to talk about the variants in Ventura County. I don't feel like we have enough numbers to talk about that yet. We hardly have enough numbers to talk about the variants in California, but these are reasonable numbers so that we can approach that conversation. The state and other private entities are really stepping up what's called whole genome sequencing, which is our ability to distinguish that original Wuhan virus from the UK virus, the South African virus, the Brazil variant. So that information promises to give us hopefully county level information about these variants in the next weeks or months. That's what the state says. We'll see if they can follow through, but I don't think that we're that far away from that being able to be accomplished. Right now, we have information from these two labs that are the top two names on the left-hand column, Aegis Lab and LabCorp, that have looked at these variants in the state of California, and I'm assuming that this applies also to Ventura County. The Aegis Lab and the LabCorp together have looked at 437 specimens doing whole genomic sequencing, looking for the different variants. They have found between the two labs that 15% of them, that's in the bottom line, 15% of them are the UK, United Kingdom variant, about 1% are the South African variant in California, and another 1%, 1.4, are the Brazil variant in California. That leaves 83% unaccounted for. But in reality, this slide only shows them unaccounted for. They have been accounted for to a degree. Next slide, please. Separate information gives us an idea about what those might be. The blue line at the very bottom is B1351. That is the South African variant. And the Brazil variant is running along at that same level. The yellow level is the UK variant in California. And that green and that red are not the Wuhan variety, that original variety that came out of China. Those much bigger numbers are what are called the two West Coast variants of interest. Those are variants of interest, not variants of concern. Variants of concern have some demonstrated ability to cause a problem for us. Maybe they're able to evade the vaccine coverage. Maybe they're more contagious. Maybe they're more deadly. Those are vaccines of concern. The red and the green are vaccines of interest. California or West Coast. California officials are fighting them being called California variants. They want them to be called West Coast variants instead. But you can see they're in much greater numbers, 45% and 15, 16, 17% for the two of them. In fact, it looks like they're on the verge of squeezing out the original Wuhan virus altogether. Next slide, please. But people, and when we see Pfizer, we really should think mRNA because the Pfizer and the Moderna vaccines are just so similar in every way. And the recent research on the vaccine shows that it is capable of neutralizing, overcoming the Brazil, which is the P1 variant, nearly as well as the original strain of the virus. In fact, the virus neutralizes the UK variant and the Brazil variant of the virus almost as well as it does the original virus that it was made to neutralize, the Wuhan virus. The ability of these vaccines to neutralize the South African variant is not the same, but it is still considered robust. it's adequate. Now, the truth of the matter is, in real life, I'm not aware of anywhere where there has been a significant degree of vaccination penetration in the population where the variants have taken off. That's not to say that it can't happen or that it won't happen, but we've not seen these variants cause a surge yet in populations that seem to have received a good amount of vaccination. And so the proof is in the pudding, and that is that the vaccines that we're currently getting seem to be working to protect us against these variants, which is really good news. So let's go on to the next slide, please. All right, so this is what was paper and pencil worthy. If you want to get a vaccination, I wanted to address that right now. Particularly, I'm interested in talking to elders, seniors, people 65 years of age and over. We're at about 85% penetration into that group. We shouldn't be satisfied with that. We should shoot for 100%. And I think we're going to make efforts to do that. And here's how we're going to do it. Now, some of these things I'm going to be saying right now are also true for anybody who wants the vaccination. So right from the beginning, if you've got any kind of computer skills at all, and you want to schedule an appointment, no matter who you are, a senior or a 16-year-old, go to myturn.ca.gov. Please write that down, myturn.ca.gov. As Mr. Zimmerman pointed out, the appointments are not filling as rapidly as they were before. And so now, if you've been postponing doing this because it's just been too much of a contest, now is the time to start doing it. You're going to have more success. Now, focusing more on seniors, but this can apply to others as well. If you want to make an appointment by phone because you're not quite as skillful on the computer, the state has a phone line that can help you get a spot. And write this down. That number is 833-422-4255, 833-422-4255. You are going to get all of the county-run locations, the ones that you've known about, plus there are additional state-sponsored locations in our county that are also available and open to you. So this is the whole wide gamut, the whole wide range of possible places to get an appointment. If you are having difficulty leaving your home, if you have a mobility issue, please don't let that stop you from getting a vaccination. This is another phone number for you to write down, and this is the last thing I'll ask you to write down, is please call this local number, 805-477-7161. That's 805-477-7161, and ask for help getting vaccination. We should be able to come visit you directly at your home. And for the third time this morning, anyone else 16 years of age and older in your home who's not been vaccinated will also be eligible to receive a vaccine on that visit. Bring your neighbors over. We want to vaccinate the population. If you're living at a large senior facility and you've noticed that very few of your fellow seniors have been vaccinated, let us know. We can almost certainly arrange a pop-up clinic to set up on the premises there. And this is something new. If you've had your first dose of vaccine, regardless of what your age is, if you've had a first dose of vaccine and you've been struggling to book your second dose, and go ahead and book your second dose. It's the surest way to do this. But you are now eligible to drop in at one of our vaccination sites and ask for your second dose of vaccine without an appointment. And if you are 65 years of age and older and have not received a vaccination, and you have not been able to schedule an appointment for whatever reason at MyTurn, not been successful or been able to call in, there's a good chance that if you just drop in, if you're 65 years of age or older, at one of our vaccination sites, they will let you receive your first dose of vaccine without an appointment. And I want to stress once again that it's only for elders and people in need of a second dose that they can drop in at one of the vaccination sites. Otherwise, things will be total chaos. And let me just mention, I don't have a slide for this, but I just wanted to talk about those that are hesitant to get vaccinated or undecided. Please don't let other people decide for you as to whether you should get your vaccine or not. If you are in a book club or a bridge club or a member of a church and it is unpopular in that group to get a vaccine and people talk about, I'm not going to get a vaccine. Don't let other people decide for you. You get a vaccine. It's the smart thing to do. It's the safe thing to do. If there's other reasons that people are concerned about getting a vaccine, they've heard that vaccines cause sterility. Now, this is ridiculous. There's absolutely no evidence to support this. There is evidence that, like election interference, that this is a Russian intervention into social media that is spreading a rumor like this. And I guarantee you the people that are sitting in Russia that are spreading a rumor like this have had their vaccination. It does not have, this vaccine, a tracking device in it or cause mind control. That is also a ludicrous suggestion. Again, the side effects of the vaccine, they're not terrible. They're like any other vaccine. They could be a little bit more exaggerated, but any side effects are evidence that the vaccine is working, it's taking, and they're treatable by Tylenol. If you get the disease, that's not treatable by Tylenol. There can be serious, very serious outcomes of that. Corners were not rushed. There was an aggressive push to clear the way. A lot of the bureaucratic obstacles were removed to approve these vaccines, but not safety measures. So please don't let that concern get in your way. And then in terms of these vaccines getting into your DNA and altering your DNA. Your DNA, all of our DNA, is in the nucleus of our cells. Our cells are in large part cytoplasm, which is the big part of the cell, and then in the center of the cell is a smaller nucleus. The nucleus has DNA, and when it wants to put itself into action, to have the cell do what it wants to do, it creates mRNA and sends it out into the cytoplasm, and then it does its job out there. That mRNA that we produce can't get back in to the nucleus to approach the DNA. Why would it even want to? It was sent out of there to do another job. In the same way that the mRNA vaccines, when they're injected, they get into your cytoplasm, but they don't get into your nucleus. These vaccines don't do any of these things that are rumored, negative things that they're rumored to do. And when they do, when there's concern, they get pulled off the market, like the Janssen vaccine has been pulled off the market for close evaluation. I'm done with my comments. I'm available for any questions.
Thank you so much, Dr. Levin. I see two supervisors with hands up, so I'm going to call on you. Supervisor Long and then Supervisor Ramirez.
Yes, Dr. Levin, thank you so much for that information. I appreciate the input in doing the vaccines. I've received lots of questions from people as to if we should do the vaccine, if we shouldn't, and why are you doing it? All those different questions. And I think vaccines in a whole has been a tough conversation for people. So I appreciate your in-depth input on that. Thank you.
Thank you, Supervisor. I'm so concerned that people are being influenced by others not to get the vaccine. There's really good solid evidence out there on CDC sites, other scientific sites that support this. And we should be responsible for our own health and make our own decisions.
And Supervisor Ramirez.
Thank you, Dr. Levin. That was just so brilliant what you just said. I appreciate it very much, especially I always like to say for folks who don't want to vote, you're letting other people decide for you, for your family if you don't vote. And it's the same thing with the vaccine. If other people are discouraging you from getting the vaccine, they're making health decisions for you. And don't we all want to make our own health decisions? And I really appreciate what you said about the folks in Russia, maybe other countries, who are sitting back, fully vaccinated, trying to destroy confidence in the United States, the people, the government, and it's just so wrong. Let's not let them hurt us. Thank you so much. It was excellent.
Thank you.
And I also want to thank you for this information that you're providing to the public. When we were looking at those incredibly good numbers on how well we are doing and the percentage of people now that are actually getting COVID, it's so low. There's so few people in the hospital, and you're just going, we're almost to herd immunity here. We just got to continue, and it's because of these vaccines. So I just really hope people won't say, hey, I'm going to back out and not take it because herd immunity will take care of me. No, it's just the opposite. This is the way we get to herd immunity, see that we don't get these variants that can, actually be not addressed with the vaccine. So it's just like so important now that we all do jump in and get to that herd immunity by getting the vaccine. So it's just it's essential. And I really thank you for your presentation on this.
Chair Parks, I'm hoping, it was asked earlier what number we want to get to. We want to get to 100% for 65 people and over. Okay, 99%. But the number that I'm looking for in our county to get to, and it's an ambitious number, is 85%.
And we're almost there with the 65 and older. We're at 83%, as I recall.
I think we're at 85. We're
85% with the 65 and older. Great. So we just need the rest of our population to do what our seniors, our elders are telling us to do, and
yes,
by their actions.
Listen to your elders.
Listen to your elders. And then back to you, Mr. Powers.
Thank you, Chair Parks. Yes. And thank you, Dr. Levin. Next, we know there's social and economic impacts of all of this have been severe. And so let's go to Melissa Livingston to talk about our rental assistance program.
Thank you, Mike. Good morning, Chair Parks, members of the board, Mr. Powers. For the record, Melissa Livingston, Director of the Human Service Agency. As reported out last week, we were just under 2,000 applicants for Ventura County. And as per our discussion during last week's board meeting, we all thought that number seemed a little low. In looking at the state numbers, the state, as of, we're in our 5th week now of this program running, there's just under 100,000 applications statewide. And when you look at last week's numbers to this week's numbers, the state only went up 13,000 applications. So I think we're all, a little concerned about the impact that this pandemic has had on our low income wage earners and the need for rental assistance. In reaching out and hearing stories from some of our tenants and low-income population, what we've heard is that they have made a priority of rental assistance, ensuring that they keep a roof over their head, and have given up other basic needs such as food, childcare, medical care, and transportation. So unfortunately, it appears sacrifices have been made in order to continue to pay rental assistance. That could be one of a number of issues, including the large amount of federal and state stimulus dollars that have come in to assist low-income individuals. But we're still concerned that we'd like to see the numbers go up because we'd like to fully expend the $50 million that we have in Ventura County, because we do believe that there's a need. So we continue our outreach with our 11 local network providers that are registered with the state, continuing to do outreach and technical assistance. We've also done some extensive outreach with landlord property owner associations because it's most valuable for our landlords to apply on behalf of tenants, which we have had many landlords do because it provides for greater coverage and reduction of rental obligations. In fact, up to 80% of unpaid rent versus the 25 that would go just for a tenant application. And by doing so through a landlord, it reduces that full obligation that would be owed for that period of eligibility of April 1st of 2020 through March 30th of 2021. So we continue to encourage our landlords and our local tenants to learn more and apply at housingiskey.com or to contact the call center with any questions that they might have at the helpline at 833-430-2022. It's a toll-free number. It's available 7 days a week from 7 a.m. to 7 p.m. And I'm happy to answer any questions that you might have.
Thank you, Mel.
Supervisor Ramirez, you have a question?
No, I don't. Thank you very much. Thanks, Ms. Livingston. Appreciate it.
Thank you.
And thank you, Mel, again, highlighting that landlords can apply and be reimbursed up to 80%. So housingiskey.com, great opportunity. Next up, we'll hear from Paul Stamper about our business assistance grant update.
Thank you, Chair Parks, board members, CEO Powers. I'm Paul Stamper with the CEO's office. And just wanted to give you an update on our business assistance grant program. We have received over 2,200 applications that were submitted before the end of the application period, and the review process is underway for those. And our goal is to move as many of those as possible into compliance. I just wanted to give you a sense of what some of the activities that are happening right now, because although the application period is over, we're very busy with outreach to these applicants right now. We're still getting between 50 and 100 phone calls to our call centers as a result of this outreach. And our team of disaster service workers are spending time not only sending out emails requesting updates or fixes, but also making direct phone calls to these applicants. It turns out one of the themes that we're finding is during the application process, we find out if these are native English or Spanish speakers and have our team outreaching to them in the appropriate language. And one of the themes that we found is that many of the Spanish-speaking applications or applicants had someone help them fill out and complete their application. And then when they received the follow-up email asking for a fix or clarification, in some cases, they're not quite understanding it. And in part, that's because they had someone helping them through that application process. And the fact then that we have someone from our team, Spanish speaker, calling, walking through it with them, explaining it to them, in some cases, having them log in and make the update live while they're on the call, there's just a real sense of appreciation. And we're very pleased because these are applicants that may not have made it through to eligibility without the support that they're getting. So we're happy for that. And we are still on a path where those applications that have come through without issues or corrections, we're aiming to get those first payments out send those before the end of April. But then we will also be moving additional groups into compliance and sending out those additional payments over the subsequent weeks through May. We're not going to wait till the end of May. We'll probably end up doing 3 or 4 rounds of payments. Luckily, our auditor has been very helpful throughout this process, has agreed to do multiple checks and in a way that will allow these applicants to receive those funds sooner based on the timing of when they move into compliance. Before I take questions on that, I did want to just briefly update the board on a program I mentioned last week, which is the Restaurant Revitalization Fund. Over the weekend, the SBA published additional information about this program. You can go to sba.gov/restaurants to get that information. They also have a call center that's up and active now, and that call center can be reached at 279-8898. And that information's on the SBA website as well. And so the plan for the SBA with this program is they're going to be accepting applications in 2 weeks. And again, this is for restaurants, but also that includes bars, food trucks, caterers. It's a broad interpretation of that category of restaurants. And they've identified that businesses owned by women, veterans, and socially or economically disadvantaged are going to receive priority. And what that means in this case is that for the first 3 weeks of the application period, those are the businesses that would be prioritized for processing and funding. Although they will be accepting applications from all businesses from the time they open. And again, the funding that's available through this program, the calculation is gross revenue loss from 2019 to 2020, which is potentially a significant amount of dollars for an individual business that's successful in this. In fact, the cap is at $5 million per location. So the successful applicants, although it's based on that time period for how much your grant award may be, eligible expenses will be from expenses incurred from February of 2020 all the way through the end, December of 2021. And so the website is stood up now so that applicants can go and prepare, find out what's going to be needed, and get themselves set up to be ready to apply. And of course, the county, we're going to be promoting this across the county through all of our available channels and social network, trying to get as many of our restaurants as possible to apply for that program. And with that, I'm happy to take any questions.
Thank you so much. How much is the grant that will go to the restaurants from the SBA?
Right. So the SBA can give up to $5 million per restaurant location. And so it is based on the gross revenue loss from 2019 to 2020. So it doesn't have a traditional cap other than that $5 million. There's also some set-asides within the $28 billion in funding from the federal government so that they ensure that some of the smallest level restaurants or size restaurants are going to, there's going to be funding for them as well.
Thank you. And then also in the applications for the funds that we're putting out for the small businesses, can you give me an idea about what industry those small businesses are in predominantly?
I do not have a breakdown of that for you today. I'd be happy to bring that back to you, but I can tell you from looking through it, we're seeing it across industry types, but I couldn't tell you today which ones are the most prevalent.
Okay, thank you.
Certainly.
Supervisor Ramirez?
Yes, I wanted to just say this is so great. I really appreciate our county's efforts and all of the people making this happen. I just want to say I have an experience I had last week. My husband and I were now fully vaccinated, being of a certain age. We were able to go to a restaurant, one of our favorite restaurants, and have dinner. And it almost makes you want to cry. It's been so long. We were getting a lot of takeout. We were supporting our local restaurants, but to actually go to a restaurant that's still following all the health orders, with less than 100% capacity. In fact, we were there early, and it was only 2 other patrons in the restaurant. We just really need this to come back. It's so important for our community, for our businesses. So I just wanted to say thank you, everybody who's been hanging in there so long. Thank you.
Thank you, Supervisor.
Yes, echo Supervisor Ramirez's comments. I did the same a week ago, so went out to dinner with the family. And things that you would take for granted before, yeah, it's fun, but now it's so special. It just will never take it for granted again. Every minute of it, yeah. The last bullet there, of course, very important. We are working with the team to develop additional funding recommendations. We have some additional funding, and the plan is to bring a recommendation back to your board for allocation of that funding to this round of grantees, as well as the previous round of grantees. So more to come on that very soon. Okay, next up, as your board requested, wanted to give you an update on some of our funding sources. You can see them set out there, and in particular, the newly approved American Rescue Plan Act. And for that, I will turn it over to our resident expert, Scott Powers. Thank you.
Good morning, board. Mr. CEO Powers, Madam Chair, Scott Powers, County Executive Office. I wanted to walk you through a few things. This for you right now is a big, colorful representation of our 3 funding sources that we've applied in addressing the COVID-19 public health emergency. There's an important difference in how these funds are dispersed, and I wanted to point that out real quick. The CARES Act, which was approved about a year ago, in addition to the just recently approved American Recovery Plan, are both direct fund transfers with guidance. So the funds are provided and guidance as follows it, and then we apply those funds and we are subject to single audit on those funds. The difference with that is the FEMA portion, which is in the middle. The FEMA funds is a reimbursement program. So the county fronts these costs and fronts the funds for these costs, and they're used for FEMA eligible applicable costs. And the turnaround, as you could guess in this day and age, is very lengthy. FEMA is even slower than they've ever been, and understandably so to some degree in what they're dealing with from a nationwide perspective. We have many applications in, totaling about 78 million to date. There'll be more added to it as we progress through this that are at least 6 months old. So if not longer, older than that. So we're patiently working with FEMA and working with our partner in EY and seeing those are going through its final review. In terms of the CARES Act, I want to just briefly share with you that legislation. The CRF, as we are very familiar with, was funds that was the first initial funds to address the county's response to the pandemic. We focused these funds on some internal costs, including contact tracing, DSWs, but most notably was the local assistance programs we stood up, including the business assistance grant, which Paul just mentioned, the rental assistance, farm worker assistance, and other ones as well, including support for the cities. The PRF, which we call is called the Provider Relief Fund, and these were funds through the CARES Act specifically for public hospitals and our public hospital system. The county received $44 million. HCAs and VCMC continues to expend those funds. Those funds are also eligible for revenue loss as well. So that's progressing as well. And from other perspectives, mainly in the public health, I'll call out, because we've never seen this type of funding before, obviously from a public health perspective, and an enhanced lab capacity in our public health emergency preparation that we are putting towards. And we just received word yesterday of additional funds from the PHEP portion, which is about $3.5 million, which is the educational outreach portion. On the FEMA side, these are our applications to date. Testing is the big one, of course, that we're in final review. We've been in final review for almost 45 days to 2 months. Very important. Additionally to that, we have another Great Plates application and vaccination costs. Our costs, we expect the vaccinations to be much higher than that, probably in the $6 to $7 million range. But to date, we have applied for 2.6. We continue to add our applications to FEMA for that. Room Key as well is we've applied for $6 million in applications so far. We expect to be up to around 10 million by the time we're done. And from a FEMA perspective, we've received pretty clear messaging from them that end of September is kind of the end date for these opportunities. So we'll be tracking that, of course, as well, and getting all of our documentation in that time frame. And the last portion is still to be determined in many ways, but it's the American Rescue Plan. There's a significant portion. It's called we're calling the Local Recovery Fund. It has a lot longer acronym than that, but we simplified it a little bit. The county is expecting to receive 164 million. Our city partners are expected to receive, at the last tally, is 142 million as well. So you're looking over $300 million, well over 300 of local assistance. Those funds will be used in different ways. We're excited to see the guidance, of course. We can only work off the legislative text that we have, and in terms of how those funds can be applied. The key portion of this is the revenue loss. And for the county, we don't expect that to be significant. The county, as you know, is primarily funded through property tax and charge for services and other means of those natures. But the cities have taken a large hit in terms of sales tax and what we call a hotel tax or the transit occupancy tax. And so we expect them to bring a lot of that LRF money in through lost revenue and into their general fund, and then apply it as they strategically feel is necessary in their communities. In addition, what we know of so far is the community health centers, which is about 15 million. Homeless assistance, we're excited to see the guidance on that as well. And we see some word of an Older Americans Act as well, an additional $900,000. There's a lot more to be determined in terms of what other funds are coming our way. And some come through the state, some come direct. And there's an infrastructure portion as well we're curious about. Next slide, please. In terms of the local recovery fund, from a timeline perspective, we're expecting half of that those funds to come in within the next 30 days. We've been told mid-May. And then those funds, the remaining half is within 1 year or at least 1 year after the first installment. So we're looking at 2022. The deadline is about 3.5 years to spend these funds. Unlike the CRF, as you recall, we received the funds in May of 2020. We were given till December to spend all those funds. And then at the week prior to the end of December 2020, we received, they extended that for another year. So we have a little more time here to be measured and look at how these funds can be most strategically applied to our community. In addition, of course, it's the guidance, which is really, really important for us in many respects, not only the local recovery fund, but also the homelessness funds, et cetera. And we're anticipating that anytime in May. We've heard word that maybe even earlier than that, but we're excited to see that information because that's how we can create some good strategies and apply them and come to your board for those recommendations. In general, I wanted to just cover a couple of our recommended approaches and moving forward with this as we move forward. It's really, I mentioned a measured response and just consideration that these funds are spanning over 3 years. We want to especially focus on what your board finds as a priority, including mental health, homelessness, equity, and things of that nature. Also want to include this notion of avoiding these long-term financial commitments past 3.5 years without a financially sustainable funding opportunity for these programs. And again, replenish some reserves, lost revenue. That's not in the general fund. We do know of some non-general fund departments that have been hit, namely the Parks Department and other ones in the county, but that will be a small portion we expect. And of course, infrastructure is a key part of this legislation that we've seen. So we're really curious to see how that reads and what opportunities we have there. And of course, economic recovery is important as well in terms of business sectors and in the local community. Next slide, please. So moving forward, again, we're looking at the guidance. We're really have some really good resources here in terms of NACO, CSAC, and GFOA, the Government Fiscal Officers Association, and looking at this not in a vacuum, but looking at it with other cities, counties, and some of our other partners are doing, and looking at some good ideas that they may have, and constantly coming back to your board with seeking guidance, seeking your input on how these funds can be applied within the guidance. Again, so there'll be continued engagement with your board, of course, and these are some of the aspects we're tracking. The big one, or the notable one, is mortgage assistance, which is new to our other portions of funding we receive. We've seen emergency rental assistance several times, as Melissa Livingston noted, but mortgage assistance for low-income individuals is new on the itinerary for the ARP funding. And there's other aspects, of course, behavioral health and assistance to seniors, et cetera. And next slide, please. So finally, this is still the spending plan we have, and we'll apply those funds, as I just shared with you, to these costs. We're pretty solid on the vaccine numbers so far. I'd sit around 7. We're still assuming maybe some coverage there up to 9 million, and more local assistance coming. We just mentioned, CEO Powers mentioned the BAG, the Business Assistance Grant. We'll be inserting more monies there, as well as maybe farm workers and some other aspects too. So With that, this concludes my presentation. Happy to take your questions.
Supervisor Parks, you're muted. I can't hear you. No.
I've left her speechless.
Maybe Supervisor Parks, if Madam Chair, if I could answer some questions or ask some questions of Mr. Powers.
Sure, please go ahead.
Thank you. As far as the CARES Act, I really liked your presentation in regards to the funding pools, where it's coming from. My focus really is agreeing to push funding like this slide to our community and our businesses as best as we possibly can. You know, business fees, waiving, and we've had some meetings about that. So I'm excited to see that in what Mr. Mike Powers is coming back with in that presentation. I do have concern on the Great Plates programs. So we've all gone through and delivered those warm meals to our seniors with the AAA. But I want to know how do we stop that great program? Are we going to need to continue it for a certain amount of time, even if the feds do not fund us as much? Just trying to understand the needs of our seniors based on this pandemic, and how do we assist that program as best we can? I know funding is always an important aspect, but also the needs of our seniors. And I think that I'd like to see, how does that progress when the Great Plates program goes away? And do we do a hybrid or something of that to assist the seniors? And then another one is the unemployment, with restaurants trying to get employees. I'm hearing that the unemployment checks that are coming in are very nice. However, people aren't wanting to go back to work. So how do we assist our businesses to get those employees back in with the state? It's just a question working with CSAC and NACO. And then also evictions. We are hearing, we've had all this evictions assistance, mortgage assistance. Those people are going to have to pay money back. And then what happens? Are they going to become homeless? With the Administration of Justice committee that I'm on, we talked with our justices about how do we connect the eviction to housing so that people don't get homeless and then it goes down that spiral hole. Those are questions. How do we support that as a county, making sure that we connect those that get evicted with short-term housing to make sure they get back on their feet? I have concerns when we look at our budget, that we make sure that we look at how do we get out of this pandemic in a safe manner as we possibly can, because those are the buckets when you are going through your charts. Those are what I have thoughts and questions on, to make sure that we continue to do the great process that we've been for the county. So I don't know if there's anything you want to address, but I just wanted to give those comments, because as we go through our budgets with all our departments, I'm looking at that as well.
Well, if I could, thank you, Supervisor, for that input. It's very, very, very helpful. On the Great Plates, that's a great topic of discussion that we've had as well. I want to remind the board that these FEMA funds are 100% recoverable for the county. At the same time, they're still paid by the taxpayers. So regardless of where they're coming from, they are being paid for by the taxpayers. We're expecting it to terminate in September. Every month they extend it, like 4 days before it expires, they send us an extension for 30 days. And so I've been working with Victoria Jump and AAA to start messaging the winding down, we'll say, of that in the coming months, just so it's not just an abrupt end to the individuals that are receiving these meals, but it's noted. In terms of after that time frame, my intention was to speak with and work with staff and AAA in CO's office about something that the LRF could support in a smaller fashion. So there's more to come on that, and yes, we are tracking the Great Plates. It's wildly successful. I can tell you, to date, the program has brought in about almost 50 restaurants between the World Central Kitchen program and the original Great Plates program. And we've heard reports on the World Central Kitchen side that these restaurants have hired up to 125 individuals full time to support this program, which is great news. And as they open and progress forward, we're hoping that, and we wind this down, that they will be in a place to land well and continue to be in business and be successful.
Thank you, Scott. And I'll also turn to Melissa Livingston. You touched on the eviction issue, and just before then, let you know, I just heard from Victoria Jump this morning. We have now passed the mark of 4 million meals for seniors. 4 million meals. So lots of great work. Melissa.
Yeah, appreciate your concerns, Supervisor Long, as do we. Very concerned about when the eviction prevention timeframe is lifted, and the expectation that would be extended in order to get through this pandemic. We are staying closely connected to individuals who have been reaching out to us with concerns of eviction, and we'll recognize that we have a number of programs that we might need to launch to support them. But I think, there continues to be an opportunity for advocacy at the federal and state level of addressing this issue in a way that we can protect, our citizens from loss of housing. And as we've seen just with this state emergency rental assistance program, a lot of money has been pumped into this, and we're not seeing it being spent down to the level that we anticipated. As well as with the Biden package coming, there's going to possibly be an equal amount. I think there's an opportunity to really evaluate that and redesign and repurpose it in a way that has value coming post-pandemic, rather than trying to expend it all during this period of time. So I think there's opportunities to work with our lobbyists and associations to really frame this in a way that we do put protections in place to protect those with mortgages and rental assistance and keeping them housed. Hopefully that's helpful.
Yes, no, I appreciate the comments, and it's important just to understand with funding where these programs, and at this point with the pandemic, it's the first ever pandemic we've all been through, and how do we come out of it, and really encourage the thinking out of the box of how do we connect people to the services they need, and appreciate that our county doesn't work in silos. Appreciate that we're working interdepartments to make sure that the needs of the community, like we've seen with the Thomas Fire, on our incident command, when people come in, they just say their house was burned down. They don't realize all the different services that they have to use, and to have it all come together for a person is easier than going to 20 different websites and trying to get the assistance we need. I think we excel in that as this county, so that's why I'm just asking as an overall view to kind of get that picture of, if people are going through a pandemic, what do they need versus what does our departments provide? Does that make sense? So looking at the end user and what their needs are versus these are county processes. So I think that is a strength of ours, and I hope we continue that when we're looking for the budget for next year.
Thank you, Supervisor Long. Supervisor Lavier?
Yeah, thank you, Madam Chair. Just a few comments. And I just want to say that I really appreciate staff's approach to this. I absolutely agree that it has to be a measured approach. I think we would all agree that we haven't yet seen the full impacts of COVID. And as we slowly come out of it, we're going to see more and more what the true needs are. And that's why I think we really have to be patient in our response. And I think this approach accomplishes that. But I would just say, and I know staff knows this, I think economic recovery, small business support has to be our number one priority, because I think they really have taken a brunt of the COVID impact. And so just keeping that in mind as we move forward is really keeping a close eye on how we can support the local business community is going to be crucial. And with the other things, I like to focus on kind of the short-term commitments, and then, homelessness, so much of the priorities also mentioned here. we need to keep a close eye on. But overall, I really appreciate staff's approach so far. So thank you.
Thank you. And Supervisor Ramirez?
Thank you very much, and I appreciate the comments of my colleagues here. I sometimes wonder where would we be if we didn't have the rescue plan? And of course, I'm hopeful that the infrastructure bill that's being negotiated will pass, that will really help our businesses and our communities. The issue of homelessness is huge because I think we all know people are looking for housing and cannot find affordable housing. And many people have lost homes or are living in very overcrowded situations because of the pandemic and the loss of their income. So I'm on the continuum of care, and we're looking at all of the resources available, but it seems to me the biggest problem is lack of housing available. And I think that's something we're going to have to address as a community, as a county. And there's some short-term solutions like homeless shelters. It's really very, very short-term in the scheme of things. We need to get housing in the right place, respecting SOAR, respecting the resources, but that's what it's going to take to get to house people. I'm really trying to focus on that. People call me every day, and I'm sure they're calling the other supervisors about homeless encampments, or they're trying to help people who are about to be evicted. And it almost seems like one of the major issues we have in our county that impacts life and businesses and people's comfort levels in their own community. And we've taken some baby steps. So really appreciate what the county is doing, the county team is doing, and the community's doing. And I do see some light at the end of the tunnel here. It's getting pretty bright. And I think this may be an opportunity for us to really do things better now that we have this support from taxpayers through the federal government. So appreciate everything people are doing and thinking about. And also, how do seniors I know seniors who live on less than $1,000 a month, and with their rent and other needs, they are making those terrible choices. So Great Plains has been wonderful for them. And are we going to go back to a time when our seniors are malnutritioned or have to make those choices? I hope we can figure out some solutions here. Thank you.
Thank you.
No.
Could you go ahead?
No, please go ahead.
Could you go back to the slide which showed the money going to assist homelessness? I believe it's about 4 or 5 slides back. And it showed, it was a pie chart, as I recall. Oh, no, that was it. 22, page 22, I think, or slide 22. No, the one where it showed $4.5 million. And I'm just thinking,
Slide 20.
Yeah, it actually may not be a pie chart, the one with the showing the FEMA money and there we go. Thank you. I mean, $4.5 million homeless assistance. We're getting a lot of funds. If you look at that, it's like almost $500 million. And yet $4.5 million for homeless assistance won't buy you, housing for people who, are homeless, for more than a handful. So that is really, to me, insufficient. And it is an issue that we have had before COVID, but it is even more so now. And we have been able to have these wonderful programs, Project Room Key and Home Key, to put shelter for individuals who are on the streets. But the idea that those funds are going to go away and the homeless assistance funds that are there just aren't going to do it. So as I see when we're talking our priorities, what we can do to assist people so we don't end up with the horrible situation that you see in some of these big cities with a lot of people living on the streets. It's just it's heartrending, but we also need to do what we can to avoid that. And also seeing there is kind of a continuum that you address with people who are homeless. And it may not be that they, shelters a short term, but to assume that we're going to have built housing where they can move in the near future is not that likely. You got to build it. And so I'm thinking about the transitional type of housing that we have, like we have at the rain shelter, for example. We need all of the continuum out there. And it isn't in my mind that we need to build more housing. What we need to do is we need to build more affordable housing. And I don't really buy into the trickle-down effect, because unless you're out there as a government entity assisting and pushing forward on affordable housing, low-income housing, like we did with the farm worker housing, we're not going to be doing our best to address this issue of homelessness. So I do want to see what it is that we can do. And it was nice also on our agenda today, we put in $855,000 for food share. I mean, that we have these wonderful partners out there, and we have great partners out there that are nonprofits helping with the providing affordable housing. But I hope that we can really step up and not let that, as we move out of the pandemic, let that one slide for people, because if they've been damaged by the economy, if they are, once they they can't pay their rent or they lose their home, it's so much harder to get them back into housing. So also preventing people from ending up on the streets. So I would like to see that as a priority with these funds too. It is astonishing to look at that slide to see the amount of funds that are coming. And I think good questions too about that transition. What are we going to do when Great Plains goes away? But I do have a lot of hope for the future. I feel like, the Spanish pandemic, the Spanish flu in 1918, what came after that was the Roaring 20s, and I can see that same kind of buildup happening here with the end of our pandemic, that there is going to be so many people, the pent-up desire to go to those restaurants, to go traveling, to really take part in an economy that they haven't been able to go out there and buy clothes and things that they haven't done. So I feel very hopeful for our business community that we're going to see a good surge. I hear that there are some restaurants that can't hire enough people now as we're starting to open up restaurants throughout the region. So hopefully, as was mentioned, that those restaurants and employees in the Great Plains program will be able to find those jobs in the economy as we see the economy improving. I see some more hands up. I don't know if you still want to have more say, but Supervisor Levere, Supervisor Long, okay, Supervisor Levere, did you want to add on to this?
I'm sorry, I forgot to lower my hand. I appreciate that.
Okay. Well, then with that.
If I just may real quick, I apologize, but I don't do this enough. I really wanted to recognize a couple of individuals. We have a COVID financial team that's made up of myself and 3 of our analysts who've been on this since day one. And they've been doing a remarkable job of just data gathering and really culling all of the information out there. And I wanted to recognize Brian Friedman, Tina Wang, and especially Mike Kumazawa, who's led some really great efforts and helped put these slides together. So I just wanted to thank you for your time.
Absolutely. And when you're talking about, we haven't quite got the information and the guidelines, but we're looking at the legislation to try to figure out where it's going. I mean, just being on top of that is so helpful. Great information. Thank you so much to you and your team, Mr. Power. Yes. and Mike, did you have more comments on?
I did. Thank you, Chair Parks and board members. And echoing what Scott said about he and his team, I want to say the same about Scott. He's really our go-to leader on this for our due diligence. It is mind-numbingly complex to make sure that we're complying with these guidance and regulations that change sometimes weekly. And so to have them on top of it, being nimble, also consulting with Ernst & Young throughout, having them at the ready, and our auditor controller, Jeff Berg, it is a great collection of really sharp people keeping a close eye on this to make sure we're compliant also that we're maximizing the funding. And thank you for highlighting that, Scott. I want to thank your board for your comments. It helps us prioritize. We're listening very closely, and we really appreciate that. A couple things on the homeless piece. What do they say? Never waste a crisis, the opportunity that it creates. And so with the homeless people, the efforts to help people facing homelessness, as you recall, the team was able to house over 500 medically fragile homeless very quickly. What also happened from that was it was not just a one-time thing. A lot of folks were connected to services through that. So that has happened. Also through Project Room Key, there's still 200 people who were facing homelessness who are being housed through that. Those folks also, if that does go away, when it goes away, we'll try to transition them into homeless prevention and rapid rehousing program, which is extremely successful. As you say, one time on one parallel paths, right? You're trying to build affordable housing over here, but you can't wait. These people need housing now. So vouchers and homeless prevention funding is really important. And it's not just a Band-Aid. 90% of these folks stay housed 6 months and 1 year later. So there's a lot of wraparound that's happening. And the good thing is with this continuum of care, it makes a big difference because if this had happened 10 years ago, we'd have a general idea of where to put the funding, but not too sure. But now with this group, we know where to invest the funding to have the greatest impact. And so it's a big advantage to have that. Project Home Key also is important in our partnership with the city of Oxnard. That did draw down almost $13 million in funds as well for that transitional shelter, part of which will be permanent supportive housing as well. Senior nutrition, also just to highlight that. Yes, as your board was commenting, Victoria texted me, and they are planning right now for the nutritional needs of seniors going forward. So it is foremost on their minds. But very, very helpful comments, board members, and for our team to hear your priorities. And anyway, just to appreciate all that. I did want to go. If we could go to the pie chart real quick. I think it's the second to last slide. One more. There we go. Perfect. Thank you. Just a note on here. You see how much is going to the community, but it's almost understated too, because I want to check with Scott Powers on this. It says county operations. Well, that's a little bit of a misnomer because within that county operations, I think it's also funding the disaster service workers, many of whom are running the vaccination clinics, the mass vaccination sites, testing, tracing, all of that work, business ambassadors. Is that correct, Scott?
Yes, that's accurate. Very much so. And testing too at the time, yes.
Testing, yeah. So when you factor that in, you can see just how much of this funding your board has invested in the community.
And the jobs that they were not doing before. I mean, these are all new areas of where their expertise is just coming in so helpful.
Yeah, definitely. All right. Okay, well, I think there's maybe just one more slide, and that's just our wrap up. And you know what our plan is with your board's direction and support. And that's our report for today. Thank you so much.
Thank you. And I know we do have one comment to be read into the record. Is that correct, Ms. Martinez?
Good morning, Chair Parks, board members, and CEO Powers. This email comes from Judy Bruce, and it says, first, the real purpose behind the COVID-19 agenda is that a tiny financial elite control our world, and we're heading towards a Marxist world government tyranny. The 9 reasons people should not take the vaccine. 1, there is no proof that the COVID-19 virus exists. It is exosomes, not a virus. The PCR test is a scam, and the CDC document reveals there is a 99% chance of survival. 2, the vaccine has unusual short development phase. Vaccines are normally tested for 5 to 10 years. All trials are showing a long list of disturbing side effects, including neurological problems in the test subjects. The FDA knows that the vaccine will cause serious side effects. 3, vaccine companies will not face any liability for vaccine injuries. 4, the vaccine might make people sterile. The financial elite are behind an eugenics plan for master race. The Bill Gates Foundation has injured and killed numerous people in developing countries. Gates made a shocking slip of the tongue when he said the final solution is the vaccine. 5, the mRNA COVID-19 vaccine will change people's DNA forever. 6, the vaccine will microchip people and make them part of the 5G AI grid. Humans will merge with machines. The hydrogel vaccines will put microchips in our brains. Every vaccine taker will be tracked with a hidden tattoo. 7. The vaccine will inject people with human fetal cells and other toxins. The aluminum, MSG, and formaldehyde may cause brain damage and cancer. And that's a 250 word limit for this email. Thank you.
Thank you. And then you just have to say thank you to Dr. Levin. When he was describing these different rumors that are out there, and coming actually from Russia by people who are already vaccinated, but the idea, some of it seemed, I hadn't heard the one about the microchips in your system is what the vaccine's doing. So I'm just hoping that people will realize, to step up for themselves, to think for themselves, and understand the importance of making sure you're well and your community's well. Supervisor Long.
Thank you, Madam Chair. I just want to reiterate a grateful thanks to all of our employees, our community, just for stepping up with this whole pandemic. I'm already looking at June 15th and opening up. I hope everyone else is as well, and that our staff can get a sigh of relief that we've made it through, and just really appreciate us innovating in this county. The programs that we've had to do for the pandemic to meet the needs of our community is very innovative, with the farm workers and the pilots and the great plates and all the different things, and really appreciate the advocacy that our staff has done on the state level as well as the national level. A lot we don't talk about here at this board meeting is getting done behind the scenes. Mr. Powers, thank you so much again for working with the Kitchen Cabinet and CSAC and Ana Mana Santos and Dr. Gali and just everybody. I appreciate it. These are big steps that we're hitting on today, just to keep moving forward in a positive direction. And I just appreciate everyone's hard work. Thank you.
And thank you. And we'll go now to item 32, and then we'll go back to 31 for Mr. Jump. But right now, because item 32 is in the same topic, let's go to that one, and that's regarding a farm worker household assistance program. And Ms. Livingston, are you ready for the presentation?
Yes, thank you, Supervisor Parks. Good morning again, Chair Parks, board members, and Mr. Powers. For the record, Melissa Livingston, Director of the Human Service Agency. The item before your board this morning seeks your approval for the design of a second farm worker household assistance program, fondly referred to as FHAP2. We'll be asking for your authorization to accept grant funding from the Ventura County Community Foundation, as well as authorization for the Human Service Agency's Farm Worker Resource Program to administer this program, including distribution of the household assistance payments to eligible households in the farm worker community. Just for brief background, if you recall, your board approved the first FHAP program in 2020. And that was a collaboration between your board and a generous group of private donors. The program was designed in recognition of the disproportionate impacts of the pandemic and the impact that it's had on our farm worker community, including recognition that that same community had limited access to federal and state stimulus funding and supports. The first program came close to serving almost 3,500 households. They all received a $1,000 grant and resulted in about just over $3 million in federal CARES Act funding in conjunction with about $400,000 in private donor funds that were collected in a farm worker household assistance trust that was managed by VCCF. And then those funds were transferred to the Human Service Agency to actually administer the program on behalf of the donor group and distribute those funds. And all those funds were distributed before the end of December of last year. As the pandemic has continued and farm worker households continue to struggle and endure financial hardships, the originating donor group that organized originally, represented by Brokar Farms, House Farm Workers, MyCop, Rider Affiliated, Laderas Campesina, have again stepped up to meet the ongoing need, casting a very wide net to engage local donors to continue to meet the needs through their generous donations. So the design of the program before you today really follows many of the tenets of the original FHAP program. It provides, in this instance, grants on a case-by-case basis rather than through an application process. Grant amounts will be $500 awarded to a family with up to 2 dependent members, and $1,000 award for families with over 2 dependents. In addition, for every dollar that's donated by the private donors, BCCF will also donate $1.50 to the fund through a challenge grant amount up to $500,000. So I'm happy to answer any questions you might have.
Thank you. And Supervisor Ramirez, I see that you have a question.
Oh, I just think this is a wonderful program. I was formerly a member of the Ventura County Community Foundation Board, and under the leadership of Vanessa Bechtel and her team, they've just done amazing things, as we all know from the Thomas Fire and others. I've contributed personally to these organizations that Ms. Livingston just mentioned, and I would encourage others to do so if they have the means and the inclination. And I think it's wonderful. I would, at the appropriate time, I'd like to move the recommended action.
Thank you. Supervisor Long, you had some comments?
Just wanted to say thank you to our farmers, all of our community members that really donated to this fund so that we can continue this program for a second round. I really do appreciate it. Our community comes together and it's awesome.
Thank you. And Supervisor Ramirez, would you like to make the motion?
I'll move for approval.
And Supervisor Long will second.
Okay, we have a motion and a second. Could we please have the roll call?
Supervisor LaVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. It is great to see the funds going there. Let us go now to item 31. And this is with our district attorney and regarding some grant award. And I also introduce Mr. Jump to do the presentation. And he may be having some trouble coming on, so we can give him a little time, and then if not, we'll go to item 33. And then go back to Mr. Jump. Okay, with that, let's go ahead and go then to item 33. And when we see Mr. Jump come on, I'll call his item. So this would be then with Ms. Dill and Mr. Otten. And this is item 33. Regarding adoption of a resolution regarding 2 new classifications and donating to.
Start video. Good morning. I'm Marge.
Hello.
Hi, good morning. Good morning, Chair Parks, esteemed supervisors, and Mr. Powers. Today, I'm here before you with several recommendations. My name is Marjorie Deal, and I'm your Manager of Classification and Compensation. So we would like to establish 2 classifications, delete 2 classifications, amend the title of 1 classification, and amend the salary ranges for 4 classifications. The first recommendation is to establish 2 classifications within the healthcare agency. The recommended salaries are based on external market studies and on internal parity alignment with existing classifications. These classifications will specifically be aligning with all aspects of the privileging and credentialing process of licensed independent practitioners. This is a Credentialing Coordinator 1 and Credentialing Coordinator 2. Second, we recommend that the board delete 2 classifications that are obsolete and no longer used. Both are extra work classifications, and we still have in existence other extra help classifications which remain available as needed. Third, we would like to amend the title of one classification because this is specifically a safety classification and we don't want it limited to a single agency department. This is the classification currently titled Assistant Sheriff's Communication Manager, which we plan to change to Assistant Emergency Communications Manager. And fourth, we recommend that your board approve the amendment of salary ranges for the following 4 classifications as detailed in the letter. Supervising appraiser, supervising auditor appraiser, helicopter maintenance technician, and chief helicopter maintenance technician. The appraiser series has a compaction issue based on the fact that the supervisors are in one union and are represented by BEA, whereas the appraisers, the lower level staff, are all represented by SEIU. The recommended 10% increase will eliminate the compaction issue. And as shown in external market survey, the salary ranges for the helicopter maintenance classifications are significantly behind the market. This has gone on for several years and was noted in the previous MBAs. The recommended increases will bring the salaries into a competitive range and will result in a significant increase in qualified candidates for current and future openings. So with that, I thank you for your time and open to any questions.
Thank you. I do see Supervisor Long, you have a question, and then Supervisor Ramirez.
Thank you. Just appreciate looking at this. It's important that we rate our staff at the right level. So I appreciate that. Thank you.
You're welcome.
Supervisor Ramirez.
Well, I totally support this. I just wanted to say that I had a meeting with our sheriff a few weeks ago when we talked about the helicopters. We have some really old helicopters that need maintenance. So I totally support this. Maybe at some point we're going to have to put the money in to buy some new ones, which serve us in emergencies. Very important, especially fires and other sorts of rescues, etc. So very important to be competitive. Thank you.
You're welcome. Thank you.
I know we did just recently get a couple that we were able to renovate, and those just got into service, if I recall correctly, too. But certainly want to keep on top of that. With that, then, if there are no other questions or comments,
I'll move
we have a motion. Thank you, Supervisor Ramirez. And the second?
Second. Huber.
Supervisor Huber. Thank you. With that, could we please have the roll call? And thank you for the presentation and the work bringing us forward.
You're welcome. Thank you.
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And now let's go back then to the item from the district attorney that will be presented by Mr. Jump. And I see that you are on, and good morning.
Good morning, Chair Parks, members of the board, CEO Powers. I'm Mike Jump with the district attorney's office, chief deputy over the victim and community services division. And I bring you very good news this morning. We were successful with the grant application. And are set to receive $1 million over the course of the next 2.5 years to support staff at the Family Justice Center. And the action this morning on request of the board is to ratify the submission of our Improving Criminal Justice Response to Sexual Assault, Domestic Violence, Dating Violence, and Stalking Grant Program. And to approve and authorize the district attorney's office to sign any amendments or extensions thereto, adopt the proposed resolution establishing 2 fixed-term positions. Those are a deputy district attorney, 3, that will be working with human trafficking cases and domestic violence cases predominantly, and also some sex assault cases. And the other position is an administrative assistant 1 who will be dealing with the high increase in demand for help with temporary restraining orders that has occurred during this COVID crisis. So it's very timely. And then the fourth action item is to authorize the auditor controller to process the necessary accounting adjustments to make all of this happen.
Thank you so much for this, and got all your items right in there. I know that it's also Victims' Rights Week, so we'll be talking about that a little bit later in our meeting, but great to see these funds come in and good suggestions for programs. Do board members have any comments, questions, or a motion?
Bob Huber, I move approval of item 31.
So I'll second it.
Yeah,
Thank
Madam
you.
Chair, I just want to thank Mr. Jump. I know he's been really at the forefront of the Family Justice Center, which has been just an innovative program and such a great thing that our DA's office has put forward. So thank you for all your work you're doing there.
Appreciate that, Supervisor, and it's been a blessing, I think, for the community that we existed during this COVID period, and we're able to keep our doors open and continue to serve the public. We see about 136% increase in requests for help with temporary restraining orders. That's been sustained. That's a phenomenal amount over the past 6 months. So we're not quite out of the woods in terms of COVID's impact on our society.
Oh boy. Thank you. I'm glad that we are able to fund this and that you are able to get these grants. We have a motion. We have a second. Could we please have
Supervisor LeVere.
Yes.
Supervisor Long.
Yes, and Mr. Jump, I just wanted to say thank you. Please tell everyone who's working at the Family Justice Center, thank you. It really is a word of mouth that has been so much success because, you know, when something works, we tell our friends, and that really gives the confidence of someone else to go back and get the help that they need as well. So I just want to say thank you. It's a tremendous asset for our community.
Appreciate that so much, and I will share your thanks with the staff and thank them for their service during this Crime Victims' Rights Week.
Supervisor Huber. Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you very much. So let's now move on to item 33.
33 we've heard.
Yes, 34 is what I
30.
meant. Right?
Yep.
Yes.
Okay. Let's do 34 and then we'll be right on time for a time certain. So go ahead, and we have Mr. Pratt. Mr. Post, thank you. And this is a long time coming and a second try, but moving forward with a grant that we've received for some modifications for wells out in the Somas area. Go ahead, Mr. Pope.
Good morning, Chair Parks, board members, Mr. Powers. I'm Joe Pope, Public Works Agency Water and Sanitation Director. So I'm in front of your board this morning on behalf of Ventura County Waterworks District number 19, which serves the Somas community. I am requesting approval of one loan that will refinance an existing USDA Department of Agricultural loan, approval of 2 loans to supplement the state grant funding for the Well 2 project, acceptance of the $2.65 million state grant funding, and award of the Well 2 treatment construction contract. The State Division of Drinking Water ordered that the district reduces the levels of iron and manganese in the water produced from Well 2. And with your board's approval of the loans and acceptance of the grant funding, we will be able to complete this long overdue project and provide higher quality water to the residents and businesses in Somas. With award of the contract today, construction will start this May and the project will be completed by March of next year. The requested loans are supported by the 5-member Citizens Advisory Committee and were approved last week by the county's Financial Planning Committee. Subject to your questions and comments, I recommend your board approve the loans, grant, and award of the Well 2 construction contract.
Thank you. And then I also want to say thank you for your flexibility in working with the Community Advisory Committee. You came up with a solution that they could support and we could move forward with this. We are in a beneficial situation in the sense that previous Senator Hannah Beth Jackson and at the time Assembly Member Limon, who's now replaced her, were able to get us a grant to move forward on the treatment to these wells, which, unfortunately, in this area, sometimes the water is discolored from the iron and manganese. So it's wonderful to see that there are funds for this, which will assist as well as the rates of the customers. And important to see that those increases will then also sunset after the funding is complete. So with that, if there are no questions, I'll go ahead and make the motion to move forward on this.
Huber, second the motion.
Thank you, Supervisor Huber. And could we please have the roll call?
Supervisor LeVere.
Yes.
Supervisor Long. Supervisor Long. Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And we'll go now then to our first 11 a.m. time certain. That would be item 35. And this is regarding, I think, a second reading. I'll open the public hearing and turn it over to Supervisor LeVere.
Great. Thank you, Madam Chair. As you all recall, last week, we received and filed a presentation on the status of the county's pilot safe parking permit program on the North Ventura Avenue. And we took two primary actions. One is we directed staff to work with the continuum of care and regional partners to focus on best practices and to bring us back some potential long-term solutions to the issue of those living in vehicle encampments. And then secondly, we approved a slight ordinance amendment and did the first reading, which limited one of the overnight zones in the initial ordinance. So today we are just doing the second reading, and if there are no public comments, I'll wait for the public hearing to be closed and happy to make a motion.
And I will go ahead and close the public hearing and happily make that motion.
Okay, great. Yeah, so I'll move the second reading.
Huber, second the motion.
Thank you. Motion and a second, and good to see the progress. Could we please have the roll call?
Yes, and there are no public comments for this item.
Correct.
Supervisor LeVere.
Yes.
Supervisor Long. She said her computer was freezing.
Okay.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you.
And Supervisor Long texted me and said yes. Does that work?
If it does, we certainly will accept it.
Yes.
Hey.
There you go. Got the voice too. All right, and so that passes unanimously, and look forward to seeing continued progress with this. Just a substantial reduction in the number of people living in their homes there, and their cars rather. So with that, we'll now move on to item 36, and this is a presentation by the Museum of Ventura County. And do we, Ms. Brokaw and Mr. Kumazawa will be doing the presentation. I'll turn it over to you, Mr. Kumazawa.
Great. Thank you, Chair Parks. Good morning, everybody. Board of Supervisors, CEO Powers. I'm Mike Kumazawa with the County Executive Office. And I'm joined today by Elena Brokaw, the Executive Director for the Museum of Ventura County. And we're here today to present your board an annual report on the status of the museum. So just for a little background as to why this annual report is here before you today. Back in June of 2017, the museum sent a request to the county, the cities of Ventura and Santa Paula, as well as the Ventura County Transportation Commission. And in that request, they asked for some additional financial support and assistance. In response to that request, in July of 2017, your board approved a contribution of $125,000. And that contribution was for financial assistance while the museum partnered with our office to identify a longer-term solution and plan. And it also allowed staff in the county to complete our due diligence in evaluating the financial and operational status of the museum. Following that contribution in July of 2017, in June of 2018, as recommended by our office, your board approved a 5-year funding plan to the museum. And that 5-year funding plan had a couple of elements. First was an annual contribution of $200,000 to support the museum with their operations. There was a one-time contribution of $300,000 to help the museum assess, inventory, and digitize the collection. There was in-kind rent of a county-owned building in the city of Ventura for 5 years, and that rent was valued at approximately $75,000 a year. And then there was also a small additional contribution of $25,000 to make improvements to that building prior to the museum occupying the space. So altogether, that support amounted to around $1,325,000 and the $350,000 of in-kind rent. Now, as part of that contribution and funding plan, your board requested that an annual report on the status of the museum be provided prior to the completion of the county's budget process, and that brings us here today. So I will now go ahead and pass it over to Ms. Brokaw from the museum so that she can give you the update. We'll both be available, obviously, after her presentation for any questions. And Elena, it's all yours.
Thank you, Mike. Hello, good morning, all of you. It's so good to see you. Chair Parks, Vice Chair Ramirez, members of the Board of Supervisors, and CEO Powers. Welcome to Supervisors Ramirez and Levere. It's really great to be here. And first, before I launch in, I really want to thank you for your continued leadership during this crazy, tumultuous year, and especially from a resident's perspective for the daily emails. I can't even tell you how many times I have been waiting for those emails to come in. They have really impacted the way I live my life, and I'm just really thankful for that. So thanks. All right, on to the Museum of Ventura County. So last time I was here, I think it was early May of 2020, and we at the museum were just figuring out how we were going to find our footing in the world, the new world. At the time, I was hopeful that we would be able to continue to deliver programs virtually. I am ecstatic to be able to report the progress that we were able to make coming up. It was successful beyond our wildest dreams, and actually has completely changed the way that we operate as a museum, and I think we will always be changed. I also, at this point, before I launch in, want to say your staff has been tremendous to us. We continue to meet with them monthly. Throughout everything, we present monthly reports to them in addition to that, and they've been very, very supportive all the way along. So, I got muted, sorry about that, and I need the slide to progress, and I'm not sure how to do that. There. Okay, I didn't do anything. I'll just say next slide when it's time to go on to the next one. So as some of you may remember, after your 2018 pledge of 5 years of support, the museum adopted a reinvention plan with 6 pillars. And we're now about to enter the 4th year of that 5-year plan. So today what I'm going to do is show you a slide for each of the 6 pillars with our long-term 5-year goals, and then specifically the achievements over the last 12 months. So, first of all, relevant programs. Making our programs more relevant is absolutely the heart of our reinvention plan. And we measure our success here by how many new participants we're bringing into the museum. So in 2020, the museum moved almost all of its programs online. We started with historical articles, expanded immediately in the second week to virtual learning modules for families at home, then went to exhibits. Then we started publishing digitized photos. We started presenting virtual discussions and events and much, much, much more. So throughout the last 12 months, we've been trying to think about what the community really needs and deliver that directly directly to them. So we also handed out over 1,500 grab-and-go craft bags for families. We did a lot of support programs for artists, including stipends for working artists and scholarships for student artists. And we have been astounded at the success of this platform change, as I mentioned before. In fact, it's been so successful that by the fall of 2020, about 6 months ago, we realized we would never go back to the way it was before. And now we think of our museum as having 3 distinct sites. It has the Longtime Museum in Ventura, the Agriculture Museum in Ventura, and the third campus is our website. And if you go there, it's just chock full of not only information about upcoming events, but also a lot of online sources that you can access. One of the ways we measure our success in terms of our relevant programs is by how resonant our emails are. This is just one metric, but I'll tell you about it. So the national standard for nonprofit emails is that of the people who get them, 25% open them and 3% click through on something. So for us, our open rate is 37% and our click through rate is 13%. So almost 5 times higher than the national rate. We're very proud of that. Next slide, please. So sustainable funding. We can be as relevant as all get out, but if we have no money to let people know about our relevant programs, it doesn't mean anything. You all know that this has been a major issue for us. The only real thing I'm going to talk about here is our endowment. That was the tentpole of our reinvention plan. Our goal back in 2018 that we articulated was to get a $10 million endowment by the end of 2023. I am very, very, very pleased to tell you that we've been able to continue fundraising even during the pandemic, and we now have over $10 million in our endowment. Now, it won't start spinning off or earning so that we can't take the full distributions from that, which will be between $400,000 and $500,000 a year yet. It really won't mature for another 3 years, but we're well on our way and we achieved that goal. And we've also done a huge amount of work to ensure that we're bringing in new donors. We have a goal to bring in 250 new donors a year. We didn't quite meet that in the pandemic, but we did bring in 191 new donors, which we're proud of. Next slide. Transparent governance. Without complete transparency on how and why the museum is operated, we run the risk of losing our community's confidence and our donors' confidence. And the museum has been there before. So the board really has taken great care to institute and follow a huge number of new policies, 18 new policies, new or updated policies in the last year alone. We hold board training sessions each year. And the biggest initiative that the board took on in terms of transparent governance this year was a comparison of specific demographic information from the board and the committees of the museum versus the census, the most recent census figures. So we compared the age, ethnicity, location, where they live, and gender of our boards and committees versus the census. And as you can imagine, there were some big gaps. So all of our recruitment efforts now focus on filling those gaps and bringing all the boards and committees up to where they more closely model or reflect the demographics of the county. Next slide. I know that accessible collections is an area of great interest to the supervisors. Our goal here is to make all of our collections available online and accessible to the public. Ideally, that means that everything will be digitized and available online. That will take a very, very, very long time to get there, but we've started down that path, as you can see. We created a new platform for digitized photos, videos, and documents and published over 1,000 items. And we also continue to deaccession items, which is something we needed to do. I want to bring your attention down to midway through the 2020 achievements. We have a new platform. And as of mid-March, about a month ago, we had almost 57,000 page views on that new platform. And that is a huge achievement. What we said when we first entered into our reinvention plan is that we wanted to have a library and archives where you could want to start research on something and live in Norway, something from Ventura County and you could access our library and our archives, as opposed to having to come in, go up, talk, figure out what was available, et cetera, then request it and have it be relatively difficult to get to. And we're well on our way to doing that, as you can see from those page views. Next slide, please. Mike talked about our archives project. As you know, you made a one-time grant of $300,000 to ensure the conservation of the archives. You have distributed to us $230,000 of that grant, and we've spent about $193,000 of that grant. The museum has matched that about 1 3/4 with our own funding, including $82,000 in grants that we secured. And we have made a lot of progress on this project, which is, by the way, arguably the most complicated and difficult. Interestingly, more difficult than raising $10 million for an endowment. We continue to wade our way through processing the backlog of materials at 77 California Street, which is the site that you provided to us, and we're quickly digitizing items. We are currently in the process of developing a new collections plan. It will be the first collections plan the museum has ever had for all aspects of its collections. We have launched a disaster response plan, which was funded by a grant, and we're in the middle of a space assessment, which will help us figure out where is the best place to store all of our collections. As you recall, that was a big issue before. We've consolidated, but we still have some more work to do. And I want to let you know we've applied for 8 archives-related grants since we got the initial funding. And we're right now waiting for one for $143,000, a federal grant that we're very hopeful about, but we won't know yet. We won't know for a little bit. Okay, next slide, please. And I have 2 more pillars I'm going to get through just to give you a sense. One of the museum's core values is collaboration, which is why robust partnerships is one of our pillars. Probably the biggest initiative that we have around that this year is the launch of our Historic Advisory Committee. That committee, which is made up of representatives of many different demographic groups across the county, is tasked with stewarding and overseeing the development of a new holistic county history project, which will culminate with a permanent exhibit of our region's history in the Ventura and Santa Paula museums in 2023. And 2023, it's for 2023 because that is the 150th anniversary of Ventura County's formation, when it wasn't me, but when the residents of Ventura County successfully lobbied and got the legislature to split us off from Santa Barbara County. So we're very excited about that, and in conversations with a lot of all the cities and the county about that project, because it's very important everybody be involved. Okay, next slide. Vision. When I got to the museum in 2016, I've been there almost 5 years now. One of the big questions facing the institution was why? Why? Why was there a museum? Why was it important? Why should anybody support it? And we've spent a lot of time trying to drill down into what the museum means and why it is vital. The board adopted a new vision 2 years ago, and that vision is that we inspire strong community by connecting the past, present, and future. Our vision is not that we deliver programs or we provide education, it's that we create a greater community. And we do that in lots and lots of different ways. And this last year, we have been trying to continue to do outreach presentations, which has been a bit of a challenge, but we continue to get that word out all the time. Next slide. So 2021, we have a lot of goals this year. We are going to reopen to the public, should everything continue as it is. On June 3rd, we're opening the gardens at both sites. When we are open, we will have family programs. There will be public art installations. We're going to have weekly free wellness programs. And I'm forgetting something else, interactive activities. And the museum, the gardens will be open Thursdays through Sundays, 11 to 5, and they will be completely free. The internal galleries, which will have all new exhibits, will open on Thursday, July 1st, same hours, also completely free. We will be completely free at least through the end of 2021, and we are considering whether to continue that and would that increase more diverse audiences to come in, which is our goal. We will continue programming on our third campus, which is the website, and we'll continue to reach out to the East County to create more connections. And there's a lot of other detailed things that we are doing, but I don't need to get into all of them. They pretty much reflect, what we do is we have a strategic plan. We do monthly reports to you. We gauge when we are on the right track. And while we've made a lot of changes in our metrics this last year, we're very pleased with our direction. And so we're really continuing along on the strategies that we've had in place for a while. Next slide. And these are some of our staff. With masks, we would love to be poster children for mask wearing, by the way, if you would like us to. And we just want to thank you very much. We would not be here without you. Your support is vital and has engendered a lot of other private sector support. And we look forward to just continuing to fulfill your goals for your museum. And that's it for me. Thank you.
Thank you very much. Hopefully, is my volume okay? I was very loud for a while there, but thank you for that. It is great to see, even in these really hard times of COVID, that you're able to meet your fundraising goals and be able to kind of morph to make sure you can get your information out there to the public. And good also to see the progress being made on the archives that are important to our county. Supervisor Levere, would you like to comment or question?
Yeah, great. Thank you, Madam Chair. Just a couple comments, and thank you, Ms. Brokoff, for this update. I really want to congratulate you and your board. It really has been quite an incredible turnaround story that you've been able to accomplish in the past few years. You're hitting a lot of milestones, making a lot of great progress, even given these difficult times. So thank you for everything you're doing. It's so important that we keep the museum front and center. We really are an arts county, and this is one of our shining stars, I think, given just the history in this county and the importance of keeping it alive and for the next generation. So thank you for everything you're doing, and keep up the good work.
And your board too. Supervisor Long?
Yes. Hi, Mrs. Brokaw. I was just wondering if you could hit upon the archives a little bit. How's the progress with that? I know that was the topic of great concern in the very beginning of all this, and I appreciate the attendance and that things are going well, but that was a concern of the historic value being preserved, and wanted to get an update on that as well.
Yes, we do a tremendous amount of work on the archive. So what has happened in a longer term phase is that after we got your funding in 2018, part of the contract that you provided to us stipulated that we had to get everything out of storage by the end of 2018 and consolidated at 77 California Street or at the Main Street Museum, which was accomplished. A huge amount of materials that the museum had never formally accessioned was actually, we got rid of. And we did that in partnership with the county and with Cal State Channel Islands. So we're really thankful to both of those entities for helping us with that and for taking a lot of those materials. We were able to, so first we did an assessment of the archives. We hired an outside firm. They came in, and using that assessment, we created a plan, a 5-year plan to conserve the archives, which we are clicking away on. We were able to hire, with your funding, a project archivist. She started in 2019. She is working, her name is Cristel Jimenez. She's fantastic. One of her picture was in that last slide. And she works at 77 California Street, or has since everybody's able to go back to work. And she is working on processing all of the back catalog. So she works with a system of processing that is very high speed, low touch. Because if you're really, really, really going to process something, it takes like 45 minutes per page to do that, to look at it, to catalog it, etc. So we try to make it as quick as possible since we have so much to go through. So she has been able to get to, and now I don't remember the full number of cubic feet that she has been able to get to. Our goal is 400 cubic feet a year. So we're probably at around 600 and some cubic feet at this point of materials that have been processed. Our goal So we're making huge strides, as well as with the rest of the collection. Our goal is to have a new storage plan with everything on site at the Ventura site by the end of this year, and then to fundraise for that plan, because storage space is a major, major, major issue for the collections, as I think you know. I hope that answers some of your questions.
Yes, I think it's very important to make sure that our new supervisors know the status as well of all the preserved historical items that the county is responsible with and is working with the museum on. That is where we started with the funding and trying to figure out how to support the museum and the historic value that is actually our responsibility as a county. And so I know and the museums have been closed because of pandemic in some ways, which is unfortunate for our community, but to make sure that our historical archives are restored, and that's our responsibility when we're talking about the funding as well. I think that's important. I want to make sure that doesn't get lost, and maybe I'm missing something. So Mr. Powers, if you want to add into any of that, I saw your hand. I just want to make sure that that's discussed.
Well, thank you, Supervisor Parks, Chair Parks, Supervisor Long. I did just want to comment, if it's okay, just real quick. We've been through so much this last year and a half plus. It's easy to sort of forget where the museum was when we were having these discussions, and it was a dire situation. Not just the financial challenges, but so much backlog of these artifacts, that have been generously donated, but what had historical value and what didn't. I mean, I don't know how to measure it, but it was tons of stuff. Our team went out to all of the 11 sites, or 13, however many there were. And these were big goals that were set for Elena and the museum board, and that they're achieving them at this rate is truly remarkable. We said at the time, there's not many people who could lead the museum through this time, and Elena was the person to do it. And she developed a new board, very strong, supportive board that was able to do this. And the staff, I was able to do a tour right before things closed down at an event, and I was really struck by the quality of the staff. You're able to hire these museum professionals, their training and education, and coming from all over the country, not just right here. And I mean, there's a lot of momentum built, and what's amazing is, despite the pandemic, you've managed to keep that momentum going. So just thank you for what you're doing. It's really exciting to see where you come from. I wouldn't have imagined you'd be this far along your goals. So great job.
And you really do realize it is an old county. We have history here, and to be able to have that accessible to the public, it's so important that we are able to learn from our history and to see those things which we want to preserve. So thank you for that, and continue good work. Any other supervisors? Supervisor Ramirez, yes.
Yes, I want to thank and congratulate Ms. Burka on the success. I have been following what has happened with the museum, which I think a long time ago, people used to think it was just for the city of Ventura, which is a very important city. But it is the county archives, a place where we can learn our history. I actually have ancestors who were in the county before it was a county, actually in Santa Barbara and up and down the coast. And I note that in the last couple of days, the University of Cape Town's library holding historic archives of South Africa was pretty much destroying the history, precious thing. So important. We can't let that happen. I do support this, and thank you for what you're doing. And I'm signed up to go to a great presentation this afternoon by Roz McGrath, one of our members of one of our important farming families. And it's called Memoirs of a Feminist. I'd encourage people to sign up for those events. You have some great stuff coming online. I totally support this. Thank you.
All right. With that, then, do we need a motion to receive and file? Do we have one?
So moved.
I'll second.
Okay. We have a motion and a second. Could we have the roll call, please?
Supervisor Levere.
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes. And we'll go now to our next item. Congratulations. This is item 37, and this is regarding a public hearing, which I will open on an memorandum of agreement. And this is with, it's a very historic, another very historic time here in the sense that we are making some major changes to enhance our healthcare system. And I'll turn it over to Mr. Powers. Did you want to comment, or we'll go right to Mr. Otten?
Well, thank you, Chair Parks, board members. You said it, Chair Parks. This is historic. This is a major milestone, and just so appreciate the work of our labor team.
We only have 2 public comments left.
And the UAPD leadership. It's a new relationship for us, and we're starting off, I think, on a really good note, and with only more to come. And our physicians and our physician leadership, they're the strength of our system. Our physicians are the quality of the physicians and the quality of the care and their commitment to our patient, our mission. That's the difference maker for us. So this is it's great to get to this point, and now I'll turn it over to Mr. Otten and to being co-CEO and Dr. Cho, who've done such an amazing job of partnering and leading with UAPD and our physicians. So, Mr. Otten, take it away.
Thanks, Mike, and thank you, Supervisor Parks. Good morning. I'm Sean Otten, your Human Resources Director, members of the board. Good morning. And as mentioned, we're here to really present an inaugural memorandum of agreement with the Union of American Physicians and Dentists. It's the first of its kind. So we have 3 recommendations: to adopt the MOA, and to adopt the integration plan, and to waive a second hearing. The proposed MOA and integration plan address the wages, pay types, benefits, and other working conditions associated with the approximate 70 full-time equivalent primary care physicians who will be employed by the healthcare agency prior to June 30th of 2021. They'll start on or around that date as part of the integration project. These agreements are presented to you after comprehensive negotiations, which started in January. We met a number of times, and Tabine Kosio, who unfortunately can't be with us right now, led those negotiations for our team. The negotiations successfully resolved a number of things. The process of bringing in current affiliated clinic physicians into county employment, they'll get the first crack at county employment. It also, we reached agreement on the establishment of 2 classifications, primary care physician classifications. There's a separate board letter that will be presented to you on that matter shortly after this, and the other presentation by the healthcare agency. And this inaugural MOA that we just spoke about. So these 3 things were agreed upon. The integration agreement plan is substantially the same as what we presented to you last week with the SEIU. They get the first crack at applying to county positions. We don't expect any major shifts in number of employees or who are employed at the clinics. The proposed MOA that we'll talk about is a 3-year termed MOA beginning in June 27th of 2021. And it will have 3 general salary increases starting in, the first one will be December 26, 2021. The 3 GSIs will be for 2% each. The 2 new physician classifications that we spoke about earlier, importantly, will be in at-will positions. They're non-classified positions, but they do have administrative appeal rights in their at-will status. Then let me go into some detail on the provisions of the MOA. I won't go into massive amounts of detail, but the letter and the MOA have a lot more. But I think a very summary review, if you won't mind. It does establish 5 pay steps for the physicians. based on the number of years of experience as physicians. In addition to that, though, in addition to the base pay, there are two types of incentive pay that are introduced. And they're very familiar to physicians and follow industry practices. So the two types are, first, the family and internal medicine physicians and pediatricians covered by the MOA who meet monthly productivity benchmarks will be eligible for the productivity incentives of up to 10% of base pay and up to 12% of base pay for urgent care physicians. Secondly, the physicians covered under the MOA whose clinic sites meet quality of care metrics. Some of the metrics would be such as immunizations, diabetes care, controlling high blood pressure. These are some of the metrics that the clinics will be measured. But Dr. Cho and team will be developing more specifics on those metrics. They'll be eligible for a 5% incentive pay of base pay, 5% of base pay incentive pay. The MOA also addresses a number of other pay types, and I'll just briefly mention what they are so that you know some of the main highlights. So low risk obstetric on-call premium pay is one. Compensation, also physicians will be eligible for compensation per patient encounter for hours of work beyond their normal scheduled hours. Incentive, they'll be eligible for incentive pay for advanced training. These are, as you'll note, these are win-win kind of pay types. Win for the physicians and win for the quality of care and productivity at the clinics. Also included in the MOA is the availability of up to 80 hours of paid time for continuing medical education and up to $2,000 of expense reimbursement. So those are some of the highlights of the specialty pay types. As you would expect, also some of the basics, the new MOA establishes flexible benefit contributions, allowance for full and part-time. They're tiered, as was agreed to with the UAPD. Employees will be eligible to enter into Visera once they meet the eligibility requirements. They'll also be eligible for matching contributions in the 401k. And perhaps one of the most important aspects of the agreement is the patient care committee, whereby management and labor representatives will meet quarterly to discuss issues and action plans. So subjects may be regarding professional standards, scope of practice, staffing, productivity, quality metrics. These are important things to the operation of the clinics, and again, mutually of interest to management and labor to discuss these items periodically. The source of these funding for the MOA, I think, is the appropriate enterprise funds within the healthcare agency. And I think that Dr. Cho will, in the next board letter item, discuss in more detail how those finances are arranged. So I will not go into details on that. But needless to say, one of the assumptions that was made was that all the requested positions will be placed in the mid-range of the classifications. So of the highest level of the classifications. This introduction of this MOA will not negatively impact the funded status of the retirement plans. And lastly, we're coming up to the last points. I should note as a final, so that's a summary of the MOA provisions and its impacts and financial impacts. I'd like to also second Mr. Powers, Mike's comments. The UAPD team was a pleasure to work with. They were very professional. They were intelligent conversations, and we appreciate the whole team for negotiating this very difficult. Whenever you start something new, it's always difficult to get the first step in the process. Also, I want to appreciate your leadership, Board of Supervisors, and of course the insight that Mr. Powers always has on these things as well. Your collective direction and leadership has really helped us through. And last but not least, I'd be remiss if not mentioning our labor team, to being COSIO, Dr. Cho, and the experts who we have on our team for their professional professionalism and perseverance. Thank you in advance, and I'm happy to answer any questions you may have.
Thank you, and your team is exceptional, and both Mr. Casio can be here today, Dr. Cho and others, and this really is commendable how quickly, and this is a very complex and costly issue, and the ability to do this quickly and do it so thoroughly and well is to be commended. This really shows our county's commitment to maintain the excellent county medical services that we have. So thank you to your team. Thank you to the physicians in their new union across the table. So I'm glad that we could have this taken care of so that we can move forward on this wonderful plan that is out there to enhance our system. That's the bottom line.
Thank you, Supervisor. I should have mentioned one thing. I'm sorry to interrupt. We did learn yesterday, I believe, that the UAPD membership has overwhelmingly ratified this contract.
Right, that's right.
Thank you. I'm sorry for the interruptions.
No, absolutely. That's a key component. Definitely to have the physicians on board with their leadership too. So with that, let me go to Supervisor Ramirez.
Well, I'm just so grateful that this is coming to our board today in a great conclusion. Thank everybody. Thank all of the members of the Union of American Physicians and Dentists who are local, who've agreed to join in with the county in this new situation we're in. And of course, our team that made it happen, very grateful. And going forward, I think we're gonna have great results for our community and the patients who depend on these clinics. Thank you.
And Supervisor Long.
Yes, again, just wanted to appreciate the doctor's time in which we had our meetings with them to discuss, how they see working together with the county and joining with our clinics, and just appreciate hearing from them. I know they'll continue to work with us, and I'm glad that we were able to come to our first agreement. So it's a big step. I really appreciate it. Sean, thank you for you and your team to really listen and appreciate. I know even next year will be easier. The next time will be easier, just like with all the rest of our agreements. So thank you.
And we do have a companion measure to this, and this is item 38.
Sorry,
and,
Supervisor Parks, we have 2 public speakers.
Yeah, that's right. And let me let the public speakers know that we see that you're signed up for 3 items, all related to the same one. So just let you know that you have each one has combined total of 5 minutes for these 3 items. And shall we start with Dr. Bussey? Dr. Stuart Bussey, would you like to go?
Supervisor Parks, we received an email that he wasn't going to speak.
Oh, okay.
Thank
All
you.
right. Kind of looking at the attendance list. I do see that we have Brian Toledano.
Yes, Chair Parks, can you hear me?
Yes, we can. Please proceed.
I think it's more appropriate that Rachel Flores, the main negotiator who started these proceedings, speak first. I think.
Okay, certainly. Ms. Flores, I'm glad you're here today. Would you like to go forward now with your comments?
Yes, can you hear me?
Yes.
Thank you. Brian, thank you. Chairwoman Parks, supervisors, good morning. Rachel Flores with UAPD. More than a decade ago, satellite clinic workers joined forces to form a union, one group with SEIU 721 and the other with UAPD. Today, after a long legal battle and a ruling by PERB, the 100-strong physicians will be a part of the unionized workforce in the county of Ventura. From organizing workers to negotiating a contract, the process cannot be achieved without leaders. To the leaders that made up the bargaining committee, Dr. Ashmita Kapadia, Sierra Vista Clinic, Simi Valley, Dr. Carmen Ramirez, Las Islas Clinic, Oxnard, Dr. Catherine Sever, Las Islas Clinic, Oxnard, Dr. Emily Kimberly Cronin, Conejo Valley Clinic, Thousand Oaks, and Las Posas Clinic, Camarillo. Dr. Lucy Gary's, Sierra Vista Clinic, Simi Valley. Dr. Melissa Reese, Pediatric Diagnostic Center, Ventura. Dr. Sam Fang, Las Islas Clinic, Oxnard. Dr. Wendy Franca, West Ventura Clinic, Ventura. These leaders showed great resolve, commitment, and dedication. To the leaders at the clinics and to the physician activists, we honor you. To the supporters that wrote letters, made calls, and shared supporting words, thank you. This first contract does not reflect all the wishes, needs, or hopes of all, but it provides a foundation for future growth. I would like to recognize the dedication of the physicians. COVID-19 changed us forever. This is why I signed up to be a doctor, one physician shared. To urgent care physicians at the 5 urgent care clinics, West Ventura, Las Islas, Conejo Valley, Sierra Vista, Egg Magnolia, you are superheroes. You did not have the option to telework, and you helped alleviate the strain on emergency departments across the county during the most difficult days of the pandemic in Ventura County. Gracias. Since reaching a tentative agreement, it has come to my attention that one labor group will receive a 2.5% salary increase during the term of their agreement, while most others are receiving a 2-point increase. During the term of this agreement, UAPD looks forward to working towards an additional 0.5%. And I know other labor groups would want the same. We look forward to building a partnership at all levels for patients and providers. Thank you. God bless you.
Thank you, Ms. Flores. And it really was started with your organization moving it forward and to get us to this point. So the accomplishment. And so at this point then, we have heard the public comments, I believe, for all individuals on this item 37. So at this time,
Chair Parks, I think I still have
hearing.
a moment to speak.
We still have Brian Toledano.
Oh, that's right. I went to him and then we skipped him to go to Rachel first. So please go ahead, Mr. Toledano.
Great. Can everyone hear me?
Yes.
Good. Thank you, Madam Chair. I first want to thank both the county negotiators and the UAPD representatives. There was a lot of learning for both sides that needed to happen to come to an agreement. Most of all, however, I'd like to commend all of the providers and medical staff in the clinic system. For a solid year, we called upon them to help the entire county, to guide us all through the uncertain times that the COVID pandemic imposed. Through extra hours and daily risks to themselves, they all persevered on in caring for everyone who came to them. After all of this, they went even further, volunteering their own time to help the vaccination effort, making Ventura County a model for successful vaccine rollouts. I reiterate these heroic acts because, again, they were asked to sacrifice more for the sake of fiscal solvency. Facing the task to reapply for the positions they already occupy and increase patient workloads, they voiced their concerns for the patients that they serve and concerns about their own futures here in the community. Those concerns still stand. However, they are asked to take a leap of faith, and the doctors have done that with this agreement. I truly believe the medical community deserves more gratitude than heavy-handed words can convey. They deserve better than platitudes. I, among many, will always remember their selfless acts, especially during this time. I know many providers are eager to once again get back to the business of caring for our community. They look forward to the future and continuing the relationship made today. Thank you, everyone. And of course, thank you to the Board of Supervisors for all the time you spent in meeting with each of us. Have a good day.
Thank you. And thank you for your professionalism in working with us. I'm glad to see the resolution. With that, unless there's any other comments, our appreciation to everyone who worked so hard on this. I know we had one of those negotiation sessions went to close to 2 in the morning from what I hear. So a lot of dedication there and coffee. With that, do we have a close the public hearing, and can we have a motion?
I move the recommended action.
I would second. Long.
A motion and a second. And could we have the roll call on this?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you, and congratulations. And so now, moving forward on this, we'll go to our 11:30 a.m. time certain. This is item 38, and this is regarding the resolution adding those 70 full-time positions to our county's healthcare agency. So, Dr. Cho, this one you'll be doing, is that
yes,
right?
Yes, ma'am. Yes,
okay.
Yes, Chair Parks. Although I thought I was sharing my screen and I'm not able to do so, so I don't know if I should wait for the slide to come up or perhaps, thank you very much.
There you go.
Great. Good morning, Chair Parks, CEO Powers, and members of the board. Next slide. I'm Teresa Cho, CEO of Ambulatory Care for the Healthcare Agency. If you could advance to the next slide, please. Thank you. I'm here to present Ambulatory Care's third and final letter for the Clinic Integration Project. To recap, the goals of this integration are to create a more collaborative culture, enhance the patient experience, and build financial sustainability based on productivity, access, and quality. Next slide. To support this integration, Ambulatory Care is requesting the transition of 104 physicians, representing 70 full-time equivalents, to county employment. This includes 58 family medicine and internal medicine physicians, as well as 12 pediatricians who care for patients at our 18 federally qualified health-centered clinics. Next slide. Ambulatory Care, with the expert guidance of County Human Resources and Labor Relations, has developed a comprehensive physician compensation plan. The plan is straightforward, market-based, and financially viable with incentives for productivity and quality. It is aligned with our goals of improving access for our patients. Next slide. The components of the compensation model include a base salary with steps based on years of experience. Physicians earn a productivity bonus of up to 10% of their base salary, as Mr. Auden mentioned, which is determined by the number of patients seen per half day. A second incentive is based on the clinic's performance on quality measures, with a bonus of up to 5% of base salary for each physician. Next slide. The cost of physician salaries and benefits is about $25 million, with a concomitant decrease of $23 million in the current PSOA expenses for staffing. Together with the projected increase in revenue, the net position is positive at $1.9 million. Next slide. When considered together with the previous position request presented to your board, the overall net position is negative $2.3 million. Next slide. Here again is the pro forma analysis presented to your board originally in December, showing the improvements in operating income year over year. The net equity position is positive starting in year 2, and the operating income reaches break-even status at year 5, even without supplemental funding. Next slide. Physician employment allows for the alignment of incentives with our goals. Work is already underway to build efficiencies in our clinics so that we work smarter, not harder. Ultimately, the clinic integration will provide a structure for our safety net system that supports our physicians and their work providing high-quality care to all of our patients. Thank you, and I'll pause for questions.
Have we any questions? I think we've gotten them out of our system. Just it is such an appreciation for this happening, and you that just to realize it actually came to be. I know you've been working on this for a long time and a lot of hours, so it is quite the accomplishment. That's all I can say. And I loved what you said too. The 3 tiers or goals of this, enhancing the system, financial stability, and collaboration. That all of that is going to be better for it. So congratulations, and let's go ahead if there are no questions, and we can adopt the resolution. Is there a motion?
I'm sorry, we have 2 public comments still.
Okay, and again, the same individuals, would you like to speak again? And would you like Ms. Flores to go first? Rachel Flores, would you like to go? And if so, please proceed.
Thank you. Supervisors, just a brief comment. In addition to these 70 full-time FTEs, the county has agreed to add the per diem positions, and UAPD has submitted proof of majority support by the per diem position. So we look forward to scheduling negotiations to negotiate a section of the contract for these positions. Thank you.
Thank you. And Mr. Toledano, did you want to go also?
Yes. Can everyone hear me? I think Chair Parks cut out. Hello.
Yes, we can hear you. Mr. Toledano, did you want to comment on this one?
I did. I wanted to make sure we recognize as well Dr. Cho and Mr. Otten, even though they had Mr. Cosillo lead the negotiations, they both were there at the 11th hour, making sure to try and collaborate, as we all aim to do at 2:30 in the morning. And I also want to echo Rachel, we are fully supported on those per diem positions, and we look forward to continuing building trust between the county and the labor unions.
Okay, thank you. And I'll call on you again for the next item. You still have a minute or so left. So with that, close the non-public hearing, but we'll go ahead and entertain a motion.
I move the motion.
Thank you. The resolution has been moved. Do we have a second?
Huber, second.
Thank you. Could we have roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
And now with this, we'll
I'm sorry, Chair Parks, I didn't get your vote.
It is a yes.
Thank you.
Exclamation mark. And with that, we'll go to the last of this triad on number 39. And that is, again, opening a public hearing. And this is to adopt the classifications for the physicians, pediatricians. And I'll go then to Ms. Deal and then Mr. Otten.
Good morning again, Chair Parks, members of the board, and CEO Powers. I'm obviously Marjorie Deal, your manager of classification and compensation. My job is easy because you just heard the last two speakers with their wonderful presentations, and I'm just here to get two recommendations. One, specifically to recommend the establishment of the two physician positions. So one is the primary care clinic physician and the other is the primary care clinic pediatrician. And the second recommendation is to approve an ordinance to put these in the at will or unclassified service. We have already scheduled a second hearing for the at will on next week. So you'll see us again next week. So I'm open to suggestions or questions. And as I said, they made my job easy this time.
I'm glad for that. If there are no questions, I will go to the speakers again. And again, Ms. Flores, would you like to go first?
Thank you, Chairwoman Parks, Supervisors. To the scope of work and complexity, the physicians going under civil service unclassified will be saving the county millions of dollars in pension costs. Once again, evidence of their unyielding commitment to ensure solvency and quality patient care. And before I depart, I would just like to say thank you to Tabine Cosio, Dr. Cho, Sean, everyone who has participated in these negotiations. Thank you, supervisors, for your time and attention and your support. I wish you well, and we look forward to great things. God bless you.
Thank you, Ms. Flores, and thank you for being there and so accessible. Really appreciate it. Mr. Toledano, would you like to go next?
Yes, thank you, Chair Parks. Like my colleague Rachel Flores has pointed out, the doctors have saved the county a substantial amount of money with this classification, and I am sure we will continue to collaborate and make sure that this is a mutually beneficial relationship between the two groups. And as we finally wrap this up after much negotiations back and forth over the months, I also would like to thank supervisors for being so willing to listen. I really believe at the end of the day, all parties involved want the best for the community, and think moving forward, we are putting the right steps in the proper direction. Thank you, everyone.
And thank you too. As one of the three goals of this is collaboration, that's certainly what we have here today. With that then, unless anybody else would like to comment, I'll go ahead and close the public hearing and entertain a motion.
Huber, move approval.
Long will second.
Thank you. We have a motion and a second. And with that, could we please have the roll call?
I'm going to read the title of the ordinance into the record.
Please.
An amendment to the Ventura County Ordinance Code Division 1, Chapter 3, Article 4 of the Civil Service System. Supervisor LeVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And congratulations to our healthcare agency team and our CEO's office and Mr. Powers. Very good work and very complex. And it hopefully will be pretty seamless to the patients that we have that come to our clinics. And if nothing, they'll see some service enhancements and greater access. With that then, I believe we can go back to our, and with that we have our board comments and public comments. So let's go to public comments. Do you have any speakers, Ms. Key, or any to read into the record?
No public comments at this time.
Okay, then let us go to our board comments and start with Supervisor LeVere.
Right, thank you, Madam Chair. I'll keep it very brief this week. Just want to close today's meeting in honor of the list of those individuals who have my office has provided to the clerk. Thank you.
Thank you. And Supervisor Long?
Hello, thank you, Madam Chair. Along with the state and federal local COVID meetings, we have our California State Association Ledge Conference this week, and everything we've been talking COVID will definitely be discussed there too, along with broadband and other items. So it's going to be a great week. I wanted to also just pause and make sure that people know about our Fillmore and Piru Groundwater Sustainable Agency. It's fpbgsa.org is the website. We are working on our sustainability plan, are encouraging stakeholder engagement. And so if anyone is interested in the Groundwater Sustainable Agency's information or technical memos, please go there. Along with that, this week on April 22nd at 2:30, if you'd like to go to my Facebook or Twitter or Instagram, weird to plug that, but I'm co-hosting with the California Insurance Commissioner, Ricardo Lara, our Ventura County Homeowners Insurance virtual town hall, and our very own Elaine Himmelfarb of our Ventura County Regional Fire Safe Council will be there. As everyone knows, the drought is here again, and it is hot, and fires can happen. And to make sure that our homeowners really know what we're getting into, what your coverage is, and so forth. And so there's more information addressing fire preparedness and the resources for our homeowners. So I want to make sure that that's April 22nd from 2:30 to 3:30. And then also just like to adjourn in memory for those on our list that we have submitted to the clerk of the board. And again, to our community and staff, thank you so much for your resiliency and working together as we go through this pandemic. And I can't wait to get to the other side. So thank you all.
Thank you, Supervisor Long. And then Supervisor Huber.
Thank you, Madam Chair. I would like to adjourn in memory of the residents cited on the list I sent to the clerk of the board. I would like to call out one individual in particular. That's Barbara Orchoff. Barbara was a financial investment advisor and planner with international credentials. She was multilingual and worked and traveled extensively in Europe. While she was a gifted financial planner, she's best known for her volunteerism. She was the former president of the Moore Park Morning Rotary Club and an incredibly active Rotarian. She volunteered extensively with the Moore Park Active Adult Center and was a board member of the Moore Park Educational Foundation. She worked with the Simi Valley Hospital Foundation, the Moore Park Chamber of Commerce, was past president of her Toastmasters Club and special projects chair of the Women's Information Network of Simi Valley. She was one of those rare, rounded people who gave back much to her community and gave back so much to everyone around her. To say that she was missed by all who knew her is an understatement. Thank you very much, Madam Chair.
Thank you. And then let's go to Supervisor Ramirez.
Thank you, Chair Parks, and appreciate all of the comments of my colleagues here. And I want to remind people that Earth Day is coming. It's in a couple of days, but really it's Earth Month, and it should be Earth Day every year, every day of the year. We are coming to an inflection point in human history, and each of us can do what we can do in our homes and our businesses. The county has shown great leadership. Many of our cities are showing great leadership in addressing climate change. As we know, we've had catastrophic wildfires. We have extreme weather that's hurting human beings and, of course, all of the other creatures we want to continue living with. Extreme heat and flooding. We have a drought. And I see that Supervisor Long is going to be discussing insurance. Insurance costs are going up because of extreme weather, because of wildfires. We have contaminated water in California. Thankfully, not here in our county, but something we have to consider when we talk about this precious resource. An estimated 700,000 Californians can no longer drink safely water from their taps. So I salute everybody who's working on these critical issues of climate change, of human health affected by these challenges, and we can all do something and honor Earth. I'd also like to adjourn in memory of Charles Velasquez, Myra Garcia Santana Gaona, and also was not mentioned before, Judith Rhodes, who is a commissioner in our courts, who died a month ago. Commissioner Rhodes did family law, very tough assignment, but she handled it well. And her motto was a very great motto: life is short, don't sweat the small stuff. Thank you very much.
Thank you. Great comments, supervisors. And then I add my comments to that. We actually, this is a time when we would normally be able to have exclusive presentations on some of the momentous weeks these are. Like, for example, it's Victims' Rights Week, as I mentioned when Mr. Jump was before us. I don't know if we have the resolution that we put forward, but I do want the board and the public to know that in honor of Crime Victims' Rights Week, the District Attorney's Office is posting a new short video each day at 8:30 a.m. this week, honoring our local crime survivors and heroes. So again, at 8:30 a.m. and to see them, you can watch it at the District Attorney's webpage. It's VC District Attorney And on that, you'll see these nice short videos every morning at 8:30 in honor of Crime Victims' Rights Week. And we know that there are many people, unfortunately, who need these services. And so we are so appreciative of our district attorney's office that provides them. And now with our Ventura County Family Justice Center, we know that we have empowered and provided a pathway to recovery for 2,000 residents who have been victims of domestic violence, sexual assault, child abuse, elder and dependent adult abuse, and human trafficking. And to have that center there helping them is a real proud moment for our county, with thanks to our previous district attorney, Greg Totten, who put this on his bucket list and got it done before he left. And we know how important early intervention is. And so for that, it's so wonderful to have that place for victims to go. And then also to those in our not only district attorney's office, but working with our partnerships. Their assistance program have provided over 20,000 services to victims of crime just over the last year. And so thank you to our district attorney's office and Eric Nasarenko for his good work there. And could we please go to the next resolution, which is celebrating the Ventura County Area Agency on Agencies Volunteer Appreciation Week. Actually, I think this is actually a third one, Volunteer Appreciation Week, and just appreciate the great volunteers who are the partners with our county. And I believe there's even a third one then, and that's the one on the Ventura County Area Agency on Aging. Their volunteers, and I guess it's a part of this actually, they have donated 11,000 hours, which equates to somewhere in the neighborhood of $350,000 just over the last year. And you can see where, everything from delivering food to homes. They delivered, as was mentioned by Mr. Power, 1 million meals. And also they have a garden, which I think we'll highlight at a future board meeting, where they have grown food for seniors and over 28,000 pounds of fresh produce through their senior nutrition garden. So just thank you so much, not only helping our older adults, but also people with disabilities in our communities. The volunteers are so essential, and they are such a huge partner with our county. And really, just from a county perspective, but you think about beyond just our county, all those volunteers out there in our cities and throughout our county, just so appreciate the good work that they've done. So that's the Volunteer Appreciation Week, Victims Week, and then just on one item of interest, we are doing so well with the collaboration of our citizens as we are now approaching the high fire times. We're starting to get the warm winds, and as spring starts to dry up into summer, we know how important it is for everyone to really be aware of their environment, and in addition, where they can, to make sure that there's no brush near their homes, dried up vegetation, as well as even other types of fuel near your homes. We all have to be really aware of that. But one thing people can do also is they can join a fire safe council. And we have some of those, particularly in the West County. They have some great ones out there. We have some in the East County. But the very first individual who really started fire safe councils throughout the state of California, he has passed, and his name was Bruce Turberville. So I just wanted to recognize him too, because what a difference one person has made to bring these fire safe councils that get a lot of grant monies that are then used to make our communities more safe from fire. So our hats off to him, and our appreciation, and also our sympathy for his family and his loved ones. But what a difference he has made. And then asking also that we close in honor of the people whose names I've submitted, including some veterans and Mr. Todd Lundy, who was a veteran, as well as we had a volunteer who's been really strong in our community as we talk about Volunteer Week, who has volunteered both at the Ronald Reagan Library, but also our Stagecoach Inn Museum, and very much appreciate, and that's Joan Arrell, her great work for our citizens and for all the people on our lists. We do close in their honor. And with that, I believe I'll go to Mr. Mike Powers, and then we have some closed session items too. So Mr. Powers.
Thank you, Chair Parks. Board members, on your behalf, I, along with Chair Parks, was able to attend the swearing-in ceremony of the new Superintendent of Schools, Dr. Cesar Morales. It was a really, really powerful event. I was invited to speak, which I was really honored to do on your board's behalf, and really do feel like Dr. Morales is the right person at the right time to be leading the Office of Education, and particularly helping so many students who are facing barriers, and just his passion and enthusiasm and energy. He's already done amazing things just in his short time in the role, and I just can't wait to see what he does going forward. Also, Senator Monique Lamon and Assembly Member Jackie Irwin honored two Women of the Year. That was Regina Hatcher Crawford and Dr. Irene Pinkard. That celebration was held on April 16th, and I was honored to present a little video on your board's behalf in support of those wonderful choices. Can't think of two better folks, women to honor. Also, congratulations to Dr. Julius Socuno. Dr. Socuno is the new Ventura County Community College. He's been named the president of Moore Park College, and I was honored to sit on the panel, the interview panel for him. And if you haven't met Dr. Socuno, you're going to really enjoy it. He's just going to do a fabulous job. Great passion and energy. Really knows the school, knows the students, and is very engaging. And engaging with all the stakeholders there is really important to him. So, two more things real quick. The Walk for Kids to support the Ronald McDonald House Family Room is coming up this Sunday, April 25th. The website for that is walkforkids.org. And that family room is almost done, and we can't wait to show you pictures of it. It turned out even better than the wonderful drawings. Last, I just let you know that Ventura County Leadership Academy, the Journey to Leadership Awards 2021 are being held April 29th. I just want to identify the folks who are being honored. Alumnus of the Year, James Joyce III. Business of the Year, Pods Moving and Storage. Educational Leader of the Year, Diane McKay. Nonprofit Leader of the Year, Monica White. And last but not least, Public Sector Leader of the Year, York County Ventura's COVID Response Team. And I really want to just say that there's so many people, it truly is, along with your board, the entire county family who've been an integral part of that with our community partners. So look forward to those events, and thank you very much. That's it.
Thank you. Definitely deserving of honors, all those honorees. Great to hear. And I know we also have a 1 o'clock time certain. So at this time, our board will go into closed session. We have a separate Zoom link for that. And then we'll be back in open session at 1 p.m. for our budget presentation. So with that, we'll go to our closed session. Thank you all for your Hello, good afternoon. Welcome back to our Board of Supervisors meeting of April 20th, 2021. We're now at the time of our 1 p.m. Time certain, and this is item 40, which is receiving our budget presentations. We've been doing this almost every meeting now, and I guess we're in the A's. So we have presentations from the Assessor's Office and the Agricultural Commissioner. Is Mr. Powers available to do the intro? Or
yes, thank you, Chair Parks, board members. As you mentioned, Chair Parks, because the county is so big and we have so many departments, we're trying to schedule them, a couple at a time over each board meeting, so that your board can have more time to sort of absorb the information and ask questions and take it from there. So With that, yes, we have the Assessor's Office and Ag Commissioner's Office up today. And let me just see.
It is a great idea, I have to say, because back in the day, we used to have all of them on the same day, and your head starts spinning with all those numbers after a while. So this is a great way to get them and digest them and let us ask some good questions and have more time for it. Thank you.
Good, thank you. I don't know if, gentlemen, if you have a preference or who is planning to go first. Whatever works for either of you.
I'm ready. This is Dan Goodwin.
Okay.
Good morning. Good
Mr.
afternoon.
Goodwin, our elected assessor, why don't you go ahead? Thank you so much.
Thank you, sir. Well, good afternoon, board members. It's a privilege to be able to speak with you. It'd be even much more enjoyable, of course, if we were all in the same room, but maybe that's not far off, right? I'm fully vaccinated, and I'm sure most of you are as well. The presentation today, and following the directions CEO gave us, was to give you some overview of our office, give you some information on our background. So I'm wondering, are you able to see the PowerPoint? Did that get displayed for you? There it is. Okay, so let's go on to the next page, please. So red team, green team. I want to introduce to you the concept of thinking about the assessors department as having it's one unit, it's one organization, but we definitely have a division of duties in such a way that I call the red team the team that supports the public. We have thousands of phone calls every week asking questions about what's going on, how it works. What if I want to change ownership to a family member? What if I want to split my parcel? All kinds of things, right?
You are muted.
Am I muted?
Yeah.
So my computer says I'm mute.
I can hear
Good.
you.
I can hear you.
I think you just went out for a couple seconds, but you're right back in. Sorry for the interruption.
Okay. Do you hear me now, Chairman?
Yes.
Okay. Thank you. So what you'll see here is in this slide basically is just a brief thumbnail look at the assuring you the assessor's office is committed to providing public service, to providing excellent public service and property assessments through our pledge for integrity and respect, teamwork. And the other thing I wanted to kind of have you understand is almost all of our work is state mandated. There are 3 binders that make up the revenue and tax code. And we'll talk a little more about that later. The duties establish the critical funding that more than 100 stakeholders, actually 113 now, entities actually have a share of property tax. That's part of the duty of the auditor controller teams up with the assessor. The auditor controller distributes the appropriation, proper proportion to each of these entities. The county being one of the larger, of course. Actually, schools are the biggest beneficiary, and should say the state of California. They take about half of it. The other thing I thought it'd be worth noting is because there's lots of discussion about Prop 13, how that might have, what's been the impact on assessed values, on impact on revenue for counties and other special districts. One of the things I got to thinking about was when I first started, the assessment role was under $50 billion, right? So, and now it's over 150 billion. So it's tripled in that time. And that compares up against a population growth of Ventura County from about 750,000 to about 850,000, which means it's gone up, population's gone up about 13%. But you can see the assessed values, even with the restrictions of Prop 13, we've still increased the property tax collections in allowing Ventura County to have such a healthy structure. Next slide, please. The organization chart gives you just kind of a quick thumbnail of job titles and distribution. We're looking at an organization of 123 positions that we are committed to for this year. That just to give you a comparison, that compares to 22 years ago, when I was a new assessor, the assessor's office had 141 positions, right? So we're one of your few departments that have reduced staff while increasing our roll production from 50 billion to 150 billion. And the 150, that'll be, the number I'm looking forward to in June of this year. At the same time, we've also reduced management from about 13 positions to 8 positions, which is about a 38% reduction. Through that, we've increased the ratio of staff to managers from about, it's just under 11%. I think it was about 10.8% to about 15.8% now. So in terms of an operation, I think we're extremely lean. We try to get the most in every single way, how we stratify work, distribute it among the staff, and also computer systems, which I'll talk about a little more, extremely big. If you look at the org chart on the left side, just to kind of give you a thought, think about a title company, the assessor's office, and we're much like a title company that also has maps and addresses of everyone. It's not just real estate title company. We keep track of fractional interests, long-term leases. A long-term lease actually has a new base year value. It's a 35-year lease. We keep track of boats and aircraft, mineral interests, machinery and equipment. Part of our assessment responsibilities would be, if you think about a farm, you probably think mostly about the real estate, but also we assess the irrigation pipes, the tractors, the hoop houses. All of that equipment is part of the assessment package that makes up a farm unit. We assess them. Also wanted to bring up, kind of in the middle of the chart, still under the Chief Deputy Administration, we have exemptions. Yes, the assessor's office processes more than $4 billion worth of exemptions. In the larger categories of welfare, it's about 1.8 billion. Hospitals, about $1.3 billion. Religious, disabled veterans, museums, they make up the next group of larger groups of exemptions. So that part of the process, which is also part of the red team, those things all have to be done in order to allow the valuation process to take place. The valuation process is a duty whether the markets are going up or down. We have various kinds of episodes. We have economic episodes like in 2007, 8, 9 that had a dramatic impact on market values. That we adjusted to. We, as you know, lowered the values on. I think overall it got up to about 80,000 properties had a reduction of some kind during that time period. I think probably now we can talk about the org chart. All of these subjects that I'm bringing up today. Certainly, I'd be happy to visit with any of you board members at your convenience. Let me know and we'll schedule an appointment, and I can go through more details and or more. Or better explanations, possibly. Let's go to the next slide, please. So, thinking about what are some of the key factors of that influence assessors' activities? And really, it kind of boils down to laws, markets, and events. So if you think about the laws, I mentioned already the California Constitution, Article 13 is a dominant piece that has to do with issues tied to the activities that followed Prop 13, but also the general provisions of the Revenue Tax Code include a huge number of rules. The voters continue to approve from time to time another proposition affecting property taxes, which Prop 19 was the most recent one in November, with its implications applied in February, and then another rule in April 1st. So that's creating some changes of action that we're coping with. Board of Equalization does legal rules that help interpret and the law, and then also provides assessors with legal opinions. The Board of Equalization is also the organization the state relies upon to examine my work on a regular basis. So from time to time, the board will do a sampling of my work every few years and survey various activities to see that my staff and I have procedures and duties that properly address all of our responsibilities. Under markets, that bring up the the principle of change. If you think about a fundamental constant in valuation is the fact that things change over time. So if you've ever looked at an appraisal, they always have a date of value. Whether you look at an appraisal to refinance your home, or maybe you have a business interest in a commercial property and hire an appraiser to do an appraisal. Estate planning purposes, there's always a date of value. And the reason that's so critical is because things change over time, which obviously for your assessor's work is part of why there's this constant monitoring of market trends and disruptions, things that would cycle markets into various patterns, extremes, as well as things like Prop 13, which monitors, I should say, moderates the variations in value with the factored base year under Prop 13 that puts most properties in a 2% status. But then also there's the market value comparison. If I mentioned earlier, 2007, 8, 9, 10, markets were declining. If market value is less than the base year value, then that value is the one that we put on the roll. Okay, and then events. Our work is often called an event-driven business. One of the reasons it's been so difficult for software companies from outside of California to create a property tax system for California counties is this event-driven reality is not common, and it's difficult to program. Many variables introduced to the programmers because of it. So good, bad, and ugly. Well, of course, good things. Generally, people like it when they purchase a property. We call property transfers when they purchase. Many people are happy when they get new construction completed, whether it be a room addition and a major remodel, or it just be a total new construction. Some of the things that some of the taxpayers might consider bad is when they disagree significantly with the assessor's opinion of value and they want to appeal that assessment. Certainly, also when markets are in decline, property owners don't like to see their property values go down. They do appreciate that the assessor identifies that and sends them a value notice with a reduced value, but they still aren't happy that they've lost their values. The ugly ones are the disasters. We've had fire disasters. Sometimes there's individual disasters, and the law provides what's called a calamity claim process. So that's where our office managed the adjustments and assessments following the major fires. Also can happen where an individual property has a calamity. One of the things to keep in mind of this, and this is an important reason for your board to have such a healthy reserve as you do. There's another calamity coming someday. None of us know the day, but we can probably all remember a earthquake that was pretty substantial. Excuse me, I'm gonna need some water once in a while. Anyway, as you know, an earthquake can be a small one, but we've had big ones like the Northridge earthquake, which ran a substantial amount of destruction through particularly Simi Valley, all the way through Fillmore. I hope it's not big, I hope it's not soon, but we have to be aware that if an earthquake comes and there's a major calamity impact on our county, one of the things the assessor's staff will be redirected to is making the adjustments that are required by that event. Let's go to the next slide, please. So this is a public service example. We have a fantastic group of people that handle the telephone calls that are coming in. They also handle the public service over the counter. As you can see from this picture, we have some plexiglass partitions are in. We have the protection for communication concerns over people that might come in with a virus. Although I think as our county is surging through the better colors of the red to the orange to the yellow, my staff is certainly ready to have the public come see us. We get a lot of phone calls where people are unhappy that they can't talk to somebody in person. Large number of those with questions are senior citizens who are not as comfortable handling these kinds of important issues and explanations over the phone. But we're doing our best. We're handling roughly 33,000 phone calls a year. I think in 2020 it was over 33,000 phone calls. The staff that handles them are extremely talented in how they cover so many issues, but then they refer calls to members of the staff who specialize in the various reasons for the call. It could be business property statements. Any of you board members that have owned your own business, you know the assessor sends you a 571L form. We ask you to fill out that every year, send it out in January. Then we also, if you have a boat or an airplane, we assess those. There's issues about those. Where are they located? There's the issues of a change of ownership, or somebody wants to transfer a property, as I said earlier, and get an exclusion from reassessment. Many questions with veterans exemptions. Those almost always require a lot of questions to be answered. And it's not nearly as easy with the over the phone as it is in person. We're managing, we're getting through, but it's kind of starting to look to me like a kind of fatigue is setting in, or call it stress, with both the public, some of the staff, but mostly the public's getting stressed over this arrangement. Why don't we go to the next slide, please? So the phone calls, the answers and questions are part of the red team. What you have here is a room. We have this room is showing about a third of the new construction plans that are ready to be done. This is part of the red team in my office. Goes through these plans, identifies what parcel they're connected to, what assessment year they're applicable to, and then tags them and sets them up. So they basically are staging the work for the green team. So the green team will come in and value the property. Each appraiser will have the ones that are arranged for their assignment and their area of responsibilities. Let's go to the next slide, please. This is just an illustration. This is one of our talented people that manage the support, internal support with computer systems. We've developed a lot of customized programs with everything with Access and Excel, in addition to taking downloads from the mainframe and then processing data and then reloading it to the mainframe. It's time consuming, it's challenging. This is a work though that is extremely important, and it's another reminder of how the assessor's production has been improved with computer systems, and we're looking forward to the new system to even take it up a notch, a big notch really. Next slide, please. So the new system will have a name Oasis. That's the name applicable to the assessor's portion of the new system. The auditor controller and tax collector's part is called Orbit. And so the assessor, as you can see from this note, this will be the last year that the assessor works and produces its annual roll on the old IBM mainframe. It's an expensive relic from the past, but it works. You know, it's sort of like hand tools are good, but electric powered tools are even better. So we've been able to do a lot of things with the mainframe to update it and let's just say accelerate its benefits. But we're kind of exhausted them, and we're getting to the point in time where, which is now more than a 30-year-old system, that its program adaptability and application is kind of like a dinosaur thing, getting to a place where it'll be no longer supported by anyone, and the people that used to learn that language are not available through the schools. Okay, moving on to that. Anyway, the assessor, we're currently working with BrainSharp. They're the primary vendor who's developing the OASIS program for the assessors, be the major functioning system for our work starting in July. And we've been doing the data conversion now for 4 years. And data conversion is really one of the big things in all the counties. Riverside County, I think, has spent over 8 years on data conversion. The last bullet point, this is allowing us to going to have a lot more visibility of records, even though we started scanning documents more than 10 years ago and using FileNet back when Matt was the IT director. We still have limitations on data accessibility, and so the new system is going to really improve that. Next slide, please. So we have appraisal management and analysis. This is part of the red team here on this slide. So Maddie's working on managing commercial property work distribution and analysis of the items that have been identified, both through recordings we received from the county recorder's office, also building permits, business licenses and applications. It's all a part of that preparation. I like to kind of explain our staff as people we hire. We hire people to train them, and we pay them to make decisions. In other words, we have thousands and thousands of decisions that have to be made every month. We have a team of 123 decision makers, and that's essentially something that requires speed and talent. And those things are supported by the speed, supported by the upgraded computer system we're moving to, as well as making the best use we can of the old system. And then the talent, the employees bring the talent, and then the training gives them the skills and knowledge they need to put it into application and get the work done. And they do a great job. I'm really impressed with the staff. Next slide, please. Some of the challenges I'd like to just to be aware of for the year ahead. Certainly maintaining the public service and staff production in this COVID environment. You know, as I mentioned earlier, there's signs of stress that we're seeing now as the public. And the next bullet point, the deeds we get from the recorder's office are a major portion of what provides reappraisable events for the assessor to process. And so the recordings in the the recorder's office, the documents are probably up closer to 50%. Out of those documents, the portion that is relevant to my work, it's about a 34% increase in what we've received from the recorder's office in 2020. And the problem we're having now is it's because it's outstripping our staff's abilities, even with the number of items that they are scheduled to work every day. We're starting to see backlogs building, and so we're looking at how to best resolve that issue. The 40% increase in C&I work that Prop 8 reviews, we are concerned about the commercial value and how that's been impacted by COVID-19. I'll talk about that a little bit more in a little bit. But the part of the challenge we have right now is there's really a shortage of data, which hinders certainty, right? Assessors, stock market investors don't like uncertainty, and neither do appraisers. Appraisers want some certainty. And when you have less data than you would feel gives you confidence, your certainty factor is reduced. And so those are things we're coping with as we manage through this process. Next line you see there's some more words about the about public service calls. So just leave it that. You've already heard me. I encourage you to. I encourage the board as soon as you feel it's reasonable to open up the main administrative building again for public service. There's a lot of pent up demand there. Then the next bullet point, I want you to know that assessment appeals are an important thing to kind of have a better handle on. So typically there's more than 1,000 of them a year to handle. Right now, the schedules are getting extended because in a lot of assessment appeal cases, the public wants an in-person hearing, which that has certainly been put on hold. There's also an issue about a 2-year rule. If an applicant submits a form for appeal and they put in a value, whatever number they put on their application is their opinion value. If that application is not processed within 2 years, that value they posted is enrolled. Now that can be delayed by both the property applicant and the assessor agreeing to a delay. But the reality is there's a time clock that starts as soon as that application is filed. So it's very important to process those files, to move the application to the assessor. Some of you maybe don't know the clerk of the board is actually the custodian of the applications. It's very important for the taxpayers to have let's call it a confidence in the integrity of the appeal process, and that is definitely helped by the fact that the clerk of the board is the custodian of that application, and they track the processing of that application, schedule the hearings, provide for all parties involved the confirmation that data has been supplied, and then receive the results from the hearing board. The hearing board is actually appointed by the Board of Supervisors. In some small counties, the Board of Supervisors actually make up the Assessment Appeals Board. Certainly in a county our size, that would be a huge demand on time and not very practical. So the members that are served there are appointed by your board, and it's very important that whenever there's a new appointment made, that those selections are based on skills and talent and experience that would be suitable for the assignment. Another part of our challenges is a lot of the more complex properties are headed towards appeals. That trend kind of began before COVID, before the year 2020, but now especially we're going to be seeing a much heavier balance of commercial properties in the appeal schedule versus residential. Prop 19 implementation, I'll talk about a little bit more of that in a minute. Kind of concerned about the time. The next bullet point, should the assessor request roll close extension date? The California Assessors Association, which of course I participate in, the president at our last Zoom meeting was encouraging assessors to apply for an extension. Well, I don't like to do that. There's I put on this page significant downstream impacts. And what that is, if the assessor says, I need another month to finish my work this year because of some big reason, an important, significant fact, I mean, it's not it wouldn't be a frivolous thing. The assessor puts a lot of pressure on the auditor controller to get their work accomplished after I turn in the roll. And then that puts pressure on the tax collector to get tax bills printed on schedule. And some of the kinds of things that happen is there's things with arrangements, programming, complications, and not to mention if the tax collector does not get bills mailed in October, then if the tax collector has to wait till November to get them mailed, then the delinquency date for the first installment moves from December 10 to January. So those kind of impacts roll all through. So mostly bring that up so you're aware of it, but also to assure you that I'm going to do my best to get our work done on schedule for all kinds of important reasons. And then the last bullet point, Oasis property tax system. So the assessor, we plan to go live in this July. And so we'll be doing training and implementation then. May we have the next slide, please? Let's see, should be 11. Yeah, okay. I think some of this is kind of, I'll leave it there. You'll be getting a printed copy through, it's a document for the board, just because of time. Maybe one thing worth mentioning, it's interesting that during 2020, the value, as probably you already know, residential property has not been hindered by the influence of 2020 and the virus. Something worth mentioning, the lien date down on the bullet point fourth from the bottom, assessment roll value property as of lien date. So again, the assessors, the data value, appraisers use the data value. The data value we use is January 1st. And where that's important for this discussion is so that you're aware, while we understand, one of my challenges in looking at, for example, commercial property is, yes, I know during April, May, June, July, August, September, theaters have been closed, bowling alleys closed, all kinds of commercial properties have been closed, restricted use of gyms or closed bit gyms, restricted use on restaurants, some restaurants. That's another thing. Restaurants, if you're a fast food restaurant with a drive-up window, probably had more business than you did in 2019. But the point I'm bringing up is the assessment is as of January 1st. So while things were extremely distressed during the summer of 2020, the market view of what is ahead of us in January 21 is much different. And a point of understanding about valuation. Valuation is the present worth of future net benefits. Okay, and think about that. It's not a I remember how it used to be, right? So it's not a trend of history that you're appraising. You're appraising the present value of future net benefits of what's going to happen in the future. So by January, we have all kinds of things changing because of the success of the vaccines that were developed in terms of businesses anticipating reopening schedules, theaters, AMC working on a schedule to reopen most of their theaters by April. Anyway, so things were changing. And so these are just giving you some examples of the type of things that my office is trying to analyze so that we come up with accurate assessments. I kind of leave it there. Let's go to the next slide. So, thank you. Just something brief on Prop 19. Some of you may hear from some of your constituents, or maybe you or a family member is interested yourself in changing the ownership of a property to a child or a grandchild, and would hope to avoid a reassessment at current market value, especially if you have a very old Prop 13 value. So the rules have changed on this. The most significant one is the concept is that the property that you're transferring or that your constituent is transferring has to be their primary residence for the most part. And if it's, and it has to go to a child who it's going to become their primary residence. And so there's some rules about working that out. Before 2021, it could have been a small commercial property, it could have been a rental residential property, it could have been some other thing, or it could have been a homeowner occupied property, but that's changed. Farms are a little bit of a different thing. The farm unit is an identifiable property, and that may or may not include the principal residence, but farm units also qualify. And then on the lower bullet, base year, an individual now can move up to 3 times to various properties and continue to transfer their base year value. The difference has to do with, it used to be you had to buy something lesser or equal to the one you sold. Now it can be greater than, and the portion of value above the one you sold has a different treatment of the assessment. The other thing that's important to know for my office staff is this means we have to track many more numbers. We have to reassess everything, even if it's a straight transfer, because we have to establish market value in both conditions. Okay, next slide, please. So this will be the last slide.
Ask, it's your last one. I was going to ask how many slides. Thank you.
Okay, no, this is the last slide. This one will be very, I think, very educational from the standpoint of it'll highlight the relationship of the assessor, the tax collector, auditor, controller, also assessment appeals board, and the clerk of the assessment appeals board's county council, and then the clerk of the board tied to assessment appeals. And the reason they're interwoven in this slide is the largest revenue opportunity for property tax administration is, which is see up near the top. I guess you can kind of see if I was pointing at it. Anyway, the Senate Bill 2557 is based on a recovery of some of the administrative costs of property tax administration. And so the California legislature provided some provision to support counties in this area. And as you can see if you look at the left column under costs, you can see that the assessor, of course, is nearly all property tax administration. The assessor is about 73% of the property tax administration reimbursement, and then the other departments, the tax collector, auditor, the county council has a small part for advising the assessment appeals board, and then also the clerk of the board's portion, that amounts to about another 27%. These are fees that when taxes are paid and the auditor controller identifies how much is going to, whether it be the county of Ventura, the fire district, the city of Oxnard, city of Ventura, Caneo Rec and Park District, which is gets a very large amount of money. All of these 100 plus entities have a share of property tax, and then the auditor bills each of them for a portion of their receipts. And so this chart gives you a sense of how that comes together. Of course, it does not cover the entire cost of property tax administration, not even close, because the state takes approximately half the property tax money for schools and does not reimburse the county for their share. Otherwise, their share would be certainly over 8 million, somewhere between 8 and 10 million. So the county ends up being burdened by the largest share of the cost. But that's the purpose of this, and there's an entire report that goes with this. This is just taken from the first page of revenue sources. There's the secondary one is there's a supplemental assessment property tax administration fee that the auditor also charges. And some of you have transferred property or built something and got a supplemental assessment from the assessor, which probably bothered you because it may have come a year after you finished your purchase and you were trying to figure out what it was. Well, that's what it is. That's part of the workload, but it is an item that generates some revenue for property tax administration. So that concludes my comments for now. Thank you for your patience. And I thank you for the opportunity to give you a kind of a quick overview of what the assessor does.
Well, thank you. Thanks for the quick overview. And do any of the supervisors have any questions that they'd like to ask Mr. Goodwin? Okay, thank you.
Yes, Madam Chair. Mr. Goodwin, I just was wondering, I appreciate your talking about properties and all that turnover. Do we think that with the evictions and mortgages, people, excuse me, too many thoughts in my brain right now. More people failing their mortgages. You're saying that the property values will be still continuing to go up versus dropping down?
Yes, Supervisor. So let me speak to that a little bit. I get a copy of the different kinds of documents that are recorded each month. And a great illustration of that will prove out that actually in Ventura County, there are not hardly any let's call them foreclosures occurring. So there's two primary deeds that you would look at. One is the notice of default, and the other one is the trustee's deed. And so the notices of default, I don't know if I have that page handy. The notices of default certainly are in the single digit numbers. For the last month, and I know this, the month of March 2021 was less numbers of notice of default. In other words, it tells the property owner, it tells the business world at large, this mortgage is behind on payments by a few months. We're considering taking action, right? That's a formal notice. The numbers on those are less than they were a year ago, and the ones a year ago were less than the year before that. And then the more important one is the trustee's deeds. That's where the property is actually taken and sold, right? And though the number of trustees' deeds that were recorded in March 21 is also lower than the number of trustees' deeds in March of 2020, which was not a very big number. So I don't think in our county that's a significant issue. The eviction issue is also I don't have a handle on apartment owners and tenants. I know just from general California law has put a significant hurdle in front of a landlord that might feel they should evict someone. So I don't see that as a significant issue at this point.
Thank you.
But I don't have good data for you on apartments.
Got you. And hopefully the commercial side of it is the same, that we're still doing well with that. So thank you very much.
You're welcome.
And any other supervisors with questions? Not seeing any, I'd turn back over to Mr. Powers then.
Thank you so much, Chair Parks. Mr. Goodwin, thank you very much, and for your whole department. The big things you've got going on, helping residents through these disasters that we've had. You've been especially attentive to that. We really appreciate that, and working through this massive new implementation of the new IT system, which is essential as part of the bedrock of modernizing our system. Anyway, just appreciate all that you've done to help lead that, and your whole department has. So thank you very much.
Thank you.
All right. Next up, we'll hear from our Ag Commissioner, Ed Williams. Take it away.
Thank you, Mr. Powers. Can I get there you go. We have the PowerPoint presentation up. Good afternoon, Chair Parks, Supervisors, Mr. Powers. For the record, my name is Ed Williams, and I am your County Agricultural Commissioner. I'm here today to go over the Ag Department's budget for fiscal year 2021 and looking forward to fiscal year 21-22. Next slide, please. Next slide, please. Thank you. This is our organizational chart. Our department consists of 4 main divisions, plus our administrative office. We deal with 30 different programs and projects. Our divisions deal primarily with pesticide use enforcement, management of pests that have limited establishment in California, commodity and consumer protection, and preventing pests from either moving into or out of Ventura County. I'll go into more detail on each of these divisions later in this presentation. Our administrative office deals with fiscal and personnel management, as well as agricultural land use, addressing new program development and emerging pest issues, and agricultural policies. Next slide, please. This slide shows our allocated positions in the department. As you can see, over the last several years, we've had some, for our department, with a total of 54 budgeted positions at this time, we've had some significant increases. In 2017 and 18, the Asian citrus psyllid and bulk citrus monitoring program, along with some deficit in some of our other program areas, led to the addition of 5 additional positions at that time to deal with those new pest threats and old pest problems. And then more recently, in 2019, your board approved a program to deal with 7 new positions plus 7 new programs, everything from new pests such as invasive shuttle borers to the Be Safe program to industrial hemp. So we had a significant increase in workload at that time, and thankfully your board provided us with the resources to deal with those programs. This year, we've been spending a lot of staff resources dealing with COVID-19 issues to help ensure safety for farm workers and other agricultural operations. We've had 5 employees assigned to disaster service work throughout the county. And in addition, we're fortunate to have 1 trilingual Mishtek speaking employee and a high number of bilingual Spanish-speaking employees who have assisted with the Farm Worker Resource Program, rental assistance, and farm worker assistance programs, also providing outreach, education videos, flyers, and all kinds of things, working in weekend vaccination clinics most recently. So we spent a lot of time this year, especially working on COVID-19 response. Next slide, please. This is a slide depicting our funding over the last 6 years. At this time, our total budget is $7.45 million. Of this, approximately $2.09 million is from net county cost, and $5.3 million is revenues from state reimbursement and service fees. I really appreciate the support that your board has provided for our $2 billion agricultural industry here in Ventura County. The total economic impact of agriculture can be multiplied by at least twice when you consider the packing, shipping, trucking, agricultural inputs, manufacturing, sales of agricultural equipment, and so on. We have 4 main sources of funding for our department: state and federal aid agreements, net county costs, unclaimed gas tax, and charges for services, licenses, and registration fees. The unclaimed gas tax is an often misunderstood or not quite comprehended source of our funding, but it comes from taxes that are paid for purchases of fuel used on farms, ranches, and in landscaping that are not claimed by the farms or ranchers on their annual tax returns. The state sets aside those funds and distributes them to all counties for agricultural programs that are conducted under the supervision of the State Secretary of Agriculture. Next slide, please. So as you can see, more than a third of our funding, 36%, $2.65 million in fiscal year 2021, comes from state and federal aid through contracts and cooperative agreements, various grants, and those kind of things. This is followed by a 28%, $2.09 million, coming from net county costs from general fund. Almost 1/4 of our expenditures, 23%, $1.68 million, are reimbursed from the unclaimed gas tax. And then rounding out the remainder of our funding sources, 14%, $1.03 million is recovered through user fees for services and licenses, primarily through our phytosanitary certification program, which I'll cover a little bit as we talk about our pest exclusion division later. Next slide, please. So in 2019, I'm trying to say 19 something, your board approved 7 new positions and allocated over $700,000 for 7 new programs. These included the hemp program, which started out with the 3rd highest number of acres planted in the state and led to our hemp ordinance that your board established in December of this year. This program allows production of hemp while managing the impacts to residential areas from the odors. We also started a new invasive shot-hole borer trapping program, tree removal and green material mulching program through contracts and grants from CAL FIRE, the California Department of Food and Agriculture, and the University of California Agriculture and Natural Resources Division. Our green materials monitoring program is designed to help manage green materials moving from various pest quarantine areas into orchards that are being used for mulching under cooperative agreements with producers and haulers. The Asian citrus psyllid bulk citrus monitoring program, which started back in 2017 and 18, ensures that loads of bulk citrus that are being moved both within Ventura County and to and from other counties are protected and safeguarded to prevent spreading of those of the ACP insect vectors, which can carry the citrus disease Wanglong bean or citrus greening disease. The Wanglong bean disease is a disease that there is currently no cure for. There are some new developments that are coming along that will help protect the health of trees and prolong the life of trees, citrus trees, but they still haven't figured out a cure for that disease itself. We also started the Abandoned Orchard Abatement Program in 2019, primarily targeted at orchards that have been neglected, allowing the buildup of citrus pests and diseases that could end up spreading to other neighboring orchards. To date, 3 orchards, more than 20 acres, have been removed through this program. A small 4th orchard has been notified of the need for removal, which will be removed later in the year after the bird nesting season has slowed down. Several of the landowners who were contacted about neglected or abandoned orchards are also now working to actively manage their orchards instead of having their orchards removed. Our invasive weed management program has helped to revive the Ventura County weed management area, which involves nature conservancies, land conservancy groups, UC Cooperative Extension, university researchers, garden clubs, resource conservation district, natural resource conservation service, forest service, and others that are working cooperatively to manage and eradicate invasive weed pests, primarily in natural areas, riparian areas, and other open space throughout the county. Our Bee Safe program has revived the Bee Health Inspection Program, which used to be a strong program in the county with new funding that's been provided by the state, along with the notification system for farmers to notify beekeepers of nearby pesticide applications so that they can take steps to protect their beehives. We have registered over 120 beekeepers this year in Ventura County, compared to a maximum of 42 in previous years. So a huge increase in the number of beekeepers that we've found and identified and registered, so we can help notify of any potential pesticide applications that may impact their operations. Our inspectors have also inspected abandoned beehives to ensure that they don't present a hazard for spreading disease and managing those hives to make sure that they're properly cared for. So, next slide, please. So I think that was just our new programs over the last few years that we just talked about. The division we're probably best known for is our pesticide use enforcement. In this division, our staff renews hundreds of restricted materials permits each year, going over the various types of materials that growers may choose to use for various crops, various pests, and discussing alternatives with permit holders to help them consider the appropriate materials for the pest issues they need to address, and to understand there are alternatives to certain types of materials that may be less toxic than others. On April 21st of 2021, this year, just a week ago, I received our program evaluation from the State Department of Pesticide Regulation, where we received high marks for our overall program with no noted deficiencies, and the program was determined to be effective. It was noted that our staff gives the highest priority to pre-site evaluations with more than twice the minimum recommended number of inspections to ensure site-specific conditions and potential hazards are mitigated in advance of any restricted material applications. State staff worked alongside our Ventura County staff and found that their work was complete and comprehensive and adequately provided the necessary information to determine compliance with state laws and regulations, and appropriate enforcement actions were taken when necessary. Another priority area for the Pesticide Use Enforcement Division has been field worker safety inspections to ensure that farm workers have been properly trained in how to find material safety information, and in the event of an exposure, how to properly decontaminate and to seek medical assistance if necessary. We have hired a trilingual intermittent technical specialist who speaks Mixtec and Spanish to assist with communicating with field workers during these inspections. This has been invaluable in providing assistance to indigenous language speaking farm workers, not only within the department, but on loan to the Farm Worker Resource Program to assist with outreach and education on COVID safety, rental assistance, and farm worker assistance programs in Human Services Agency. I am planning to request a full-time position to be allocated for this purpose, at some time in the future. In addition to agriculture, we also regulate structural and landscape pest control businesses to ensure their compliance with pesticide requirements. One key responsibility we have is to investigate any and all pesticide-related illnesses. Doctors will see a patient and determine that that patient may have been exposed to a pesticide that may be leading to their symptoms, and they notify the state, who notifies our department, that we must investigate those incidents. It would probably surprise you to find out that at least half of the pesticide illnesses we end up investigating don't involve agricultural at all, but industrial, domestic, restaurant, janitorial, and other incidents of misuse, primarily antimicrobial materials such as bleach, ammonia, alcohol, and other cleaning materials. Bleach used to clean forks and knives at a restaurant, for instance, in a pitcher, was then used to serve a customer. Chlorine used in swimming pools, such as the Dalan Swim School incident, in which a chlorine gas exposure sent 17 children to the hospital to be checked out. A couple of years back was another incident that we ended up investigating, which ended up in a civil penalty that was assessed on the owners of that company. The division also covers the new hemp program, which I discussed a little bit earlier. Next slide, please. The next division that I want to tell you about is our pest management division. They survey, control, manage invasive pests that are already found in Ventura County or are established in neighboring counties in Southern California. The glassy wing sharpshooter Pierce's disease control program prevents the spread of the glassy wing sharpshooter, which is another vector, insect vector, of another disease, Pierce's disease, which is bacterial. Ventura County is infested currently with the insect pest, and we have the disease as well. And the grape growing regions, especially Napa and Sonoma, Monterey County, that grow a lot of the wines in California, are very concerned about this particular pest getting established in those counties and spreading the disease, which is another vine-killing disease that is a very difficult problem for them to address. So our program inspects every leaf of every nursery plant that is shipped from Ventura County to these other counties to make sure that we're not transporting any life stages of the glassy-winged sharpshooter that could cause some of these problems. This ended up being a record year for our local nurseries in shipping plants throughout the state. Apparently, the COVID lockdown provided ample opportunity for people to try out their green thumbs or brown thumbs, as the case may be, and a chance to grow some of their own produce while they are at it. I spoke earlier about our weed management program and about our invasive shot-hole borer programs. This division also does a non-lethal hazing program to help manage crow and raven populations, which can cause problems for neighboring avocado growers by damaging and eating the fruit. They're not called a murder of crows or a conspiracy of ravens for nothing. Next slide, please. Our Commodity and Consumer Protection Division provides protection against crop-killing pests and diseases such as the Asian citrus psyllid through monitoring bulk loads of citrus as they're being moved around, also monitoring green materials that have been shredded from lawn clippings and prunings to ensure that they are safeguarding these loads against spreading the pests. This division also collects data from growers and ranchers to develop an annual crop report, our $2 billion agricultural industry, and to assess crop losses due to natural disasters such as extraordinary wind events, freezes, heat damage, and wildfires. We protect consumers through testing the maturity and hidden quality aspects for fresh produce, both locally produced and imported from other counties and other countries. In some of the pictures that are shown here on this slide, on the top left is a picture of one of our staff that is testing citrus that is brought into Ventura County or produced here in Ventura County to make sure that it is mature and it meets the state's standards for quality. The bottom right-hand picture there shows some potatoes, some very large potatoes that came in from Idaho that ended up having an internal defect that you open it up and, oh, there's that ugly big brown spot in the middle of your potato that you don't like. So we check those things while most people don't have the opportunity to see those defects from the outside. Every year, hundreds of thousands of cartons of melons and other produce are brought into California through the port of Hueneme and distributed throughout the United States. We end up being the first line that checks the quality of these products, making sure that they meet California standards. Thousands of containers of oranges and tangerines are also brought in from other counties for packing and shipping through our packing houses, and we make sure that they are meeting quality standards as well. Our certified farmers markets locally provide farmers and consumers with fresh produce, providing an outlet for our local farmers and other farmers from around the state to sell their products straight to the consumers. Our main objective for this program is to ensure that they are actually selling what they grew themselves. That's the whole premise for the certified farmers market in California. We've had several cases recently where we've had growers that were selling turmeric, for instance, or potatoes or different items that they didn't produce, that they were claiming that they had produced, fraudulently selling those items to the consumers and misrepresenting them. So that's part of our responsibility, is to try to make sure that there's some integrity in the marketing of at farmers markets. Another question for you: have you ever wondered if the organic produce that you're paying a premium price for is actually grown organically? We end up testing those products. We take samples, submit them to the laboratory to make sure that they don't have synthetic materials that are not allowed to be used on those products for organic production. We also check the records at the companies to make sure that they're purchasing organic products when they're selling and representing products as being organic. So next slide, please. Our last division is our pest exclusion division. The key task of our pest exclusion division is to keep pests and diseases from either entering or leaving Ventura County on agricultural products. We do this by inspecting incoming shipments at FedEx, UPS, loads of nursery stock and produce from areas known to be high risk for pest introductions, and by inspecting our own products that are destined for other countries and other states to make sure we're not sending our pests to them. Our staff checked over 11,000 shipments that were sent to 83 different countries this year. They also helped all Ventura County nurseries switch over to the USDA's online tracking system for more than 900 shipments sent to other states. Another new viral disease called the tomato brown rugose virus ended up showing up here in Ventura County in a few hoop houses this year. And our staff ended up surveying for this disease as requested by the USDA and the California Department of Food and Agriculture. We ended up finding one farming company that had several small properties that were infested with this new viral disease, which were successfully removed and eradicated. Fortunately, this pest was detected and removed early enough to avoid a general quarantine for the entire county and for the state. This division also was called on to collect and turn in hundreds of unsolicited packages of seed from China to the USDA this year by unscrupulous companies that were trying to build their online profiles through Amazon and eBay. Turned out that none of those seeds ended up getting planted in any situations that end up spreading any diseases or new crop pests, but we were fortunate to be able to collect all of those, hundreds of those samples that ended up getting shipped into Ventura County alone. Next slide, please. Our administrative office deals with agricultural land use issues. We serve as the staff resource for the Agricultural Policy Advisory Committee, dealing with agricultural compatibility for any new projects, new development plans. With this, the APAC, your board appointed Ag Policy Advisory Committee, deals with the Land Conservation Act, Williamson Act, tax relief contracts, and other emerging issues for agriculture in Ventura County. Our chief deputy also deals with the right to farm ordinance issues and complaints about agricultural operations. We serve as mediators to try to help farmers and ranchers find ways to be good neighbors with people who may not fully understand the needs of agricultural operations. Next slide, please. as I stated earlier, we've been spending a lot of time this year in particular dealing with COVID-19, not only within our department. We are one of those essential agricultural operations that is necessary to keep the food system in place and moving along for the country. And so we have not stopped any of our programs. We've kind of spread our staff out a little bit as far as scheduling and spending a lot less time in the office doing paperwork and spending more time out in the field working with different programs. And so we've changed a lot of the operations here in our department, which has really been successful, I think, in avoiding some of the problems that could have cropped up. This year, our department participated in weekly and biweekly calls with what we call the Milagros group, which was the group that got together to develop the Farm Worker Resource Program in the first place. Growers and community-based organizations such as MyCop and Lideras Campesinas and CAUSE and CRLA, along with a lot of our CEO staff like Rosa and public health staff like Rigo and Selfa, all working to try to address farm worker safety issues during the COVID pandemic. As I said earlier, we provided 5 disaster service workers to other agencies in the department, in the county, for testing clinics and other types of work that are being done. 2 of our staff, including our trilingual staff, assisted the Farm Worker Resource Program. Probably spent 2/3 of his time actually this year working with the Farm Worker Resource Program, addressing the rent relief program, the Farm Worker Assistance Program, and providing MISTEC translation services. One of our staff distributed, not one of our staff, almost all of our staff got involved in distributing COVID education outreach flyers, essential worker cards, agricultural operation advisories, vaccination education outreach, and personal protective equipment. We had over 1.5 million surgical masks, more than 100,000 N95 masks that were for protection against smoke inhalation, 50,000 bottles of hand sanitizers, and tens of thousands of plastic gloves that we distributed for farm workers in the county to provide personal protective equipment during COVID. 5 of our bilingual and trilingual staff have worked in the last month and a half at multiple weekend vaccination clinics as well. So you can see we've been really busy trying to address a lot of the issues for our community, trying to help them get through this COVID crisis. Next slide, please. This is my last slide, and I just wanted to kind of go over a few of our future projects and some of our challenges that we're looking forward to. With the passage of the new ag element in the general plan 2040, several new programs were proposed for our department. This year, Ventura County received a Sustainable Ag Land Conservation Planning Grant from the California Department of Conservation, and our office was designated the grant manager for that grant. As approved in your general plan last fall, we're planning to hire at least 1 or 2 staff members in the future to help manage some of these new responsibilities. The new programs for sustainability and for local food marketing and programs and those kind of things. As you know, it's been increasingly clear that we need to do more to effectively communicate with our farm worker community. We are also hoping to hire a full-time farm worker community liaison in our pesticide use enforcement division with your approval in the future. And then just last week, I received a proposal from the California Department of Pesticide Regulation, the air monitoring division that has been sampling at the Rio Mesa High School air monitoring station for the last 15 years or so. They have asked us to actually take over the on-site sampling and submit the samples to the state laboratories for them, at least for the next 3 years. So I'll be bringing that proposal to your board at some point in the near future. Next slide, please. As you can see, the Agricultural Commissioner's Office has been busy this year, not only with our regular duties and programs, but especially in working with the farm worker community to provide information and equipment for safety during COVID, to help facilitate various programs in cooperation with the Farm Worker Resource Program and looking into the future with the new sustainable programs proposed in the new General Plan 2040. You know, I have to say that I'm extremely proud of the way my staff and the Ventura County agriculture industry has stepped up in an extraordinary and professional way to address all of these sudden changes that and continual changes that we've faced this year. I feel truly blessed to have the opportunity to work with this group in particular, and I want to thank you, board members, for your constant support of the agricultural industry and in particular our department. Can you please let me know if you have any questions? Thank you.
Thank you, Mr. Williams. Supervisor Ramirez, I see your hand up.
Thank you, Mr. Williams. A few weeks ago, my staff and I got a presentation of that is somewhat similar to what you've done today. We took more time to ask a lot of questions. I was very impressed. I then had the opportunity to observe a hearing about a particular company being challenging a fine about pesticide protection for employees. It was very informative, and it just made me think how careful we have to be with these chemicals, because it actually was reported by a person driving by, not a farm worker, not somebody in the field, but a person driving by who smelled something different as they drove by one of the fields. And it turns out that it appeared that the worker distributing it did not know how to protect himself or the public, and didn't seem to have water close by to irrigate his eyes. And so it just kind of brings it home that we have agriculture and we have to protect it. And sometimes chemicals and other products are used you have to be used very, very carefully because they have consequences. I've spent a lot of time representing farm workers who've been injured, suffered long-term harm from inappropriate pesticide use. So I'll just leave that there. I wanted to really thank you for mentioning this is nesting season, so please don't trim your trees right now with the little birds who are already struggling to have a family, are trying to keep their nest safe, and the bees. So really great. That agriculture is very important to our county, to our people, to those of us who just enjoy it when we go to the store. And this is very important. So thank you, Mr. Williams. Appreciate it.
Thank you, Supervisor Ramirez.
Madam Chair, just a quick comment. I just want to thank Mr. Williams. It's been a challenging year across, all of the departments, but particularly your department. And so just thank you for everything you've done to make sure that the agriculture industry kept moving this year in a safe manner as well. So thank you, and looking forward to a lot of interesting seemingly innovative programs. So thank you.
Thank you, Supervisor Levere.
Yeah, and then I also look forward to in the future as we look at our 1,000 trees a year that are decided to be responsible for planting as part of our climate change action plan, working with your office to have a better understanding of those trees that are best in our area, and I appreciate your help with that.
Yeah, glad to help there.
Thank you. All right. Well, thank you very much for the presentation, and I'll send it back to Mr. Powers.
Yes, thank you, Chair Parks and board members. Just as Mr. Williams said, his staff has been amazing during this pandemic, partnering with the Farm Local Resource Program and community partners. But just throughout the year too, he and his team do a lot to just reaffirm and foster the quality of fruits and vegetables that are grown here in our county with their quality inspections. People know when it comes from Ventura County, it's high quality, it's high grade. That doesn't happen by accident. It's a lot of laborious, hard work. And that's what the ag professionals that Ed leads and supports that do every day. So great job. Thank you.
Thank you.
That's it for our budget presentations today, and we'll have more next week for your board.
Thank you. And I would just add, not only provide confidence in our fruits and vegetables, but also in our agricultural commissioner's office. You know, they do a great job.
Hands down.
All right, then I think at this point we can adjourn our public meeting or go into closed session and adjourn from there.
Do we need to make a motion for this one?
Yes, let's go ahead and do receive and file. Would you like to make that motion?
I'll make that motion. Thank you, Chair.
Huber, second it.
Thank you. And could we have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. And Mr. Barnes, do you know if you anticipate any announcement from our closed session?
No, we do not.
Okay, then we will adjourn from our closed session, and that concludes our public portion of our meeting.